It's
I'm 5 o'clock.
If you need anything, text me.
Awesome.
Okay.
Hi everybody, Ziv Simon here. Welcome to this broadcast. We are live on a few platforms. We are live on Facebook and on YouTube Live and also on the broadcast page. The reason we created that, there were so many questions following the training and the replay of the broadcast that we shared with you last week. And we decided to create this broadcast to answer a lot of questions that a lot of doctors were having about implant surgery. And we have lots of time here in the studio. I'm together with Dr. Rashad Ryman right in here behind.
Hi guys and ladies.
Behind me, don't forget the ladies.
No.
And we have Michael, our editor. We're going to start this broadcast, so make sure to ask me anything that you want. I'd like to answer. I'd like to help you incorporate some of these principles in your practice. I'd like this broadcast to be actionable with advice and good clinical information that every dentist can utilize in their practices when they're placing implants. So we're going to get started in just a couple of minutes. Make sure to leave your comments below. This is totally live, unscripted. We are going to answering your questions. We have multiple people monitoring your questions on the different platforms. And I think we should get started. Okay, so Michael, let's go.
Sound test. Striking lights. Camera action. And we're on. 3.
Hi everybody again, Ziv Simon here together with Dr. Rashad, can't say your name, Rashad Ryman, my friend and my partner at Surgical Master. We are live on Facebook, on YouTube Live, and on the broadcast page. So wherever you're watching us, totally live, we have about maybe 6 seconds of delay. There may be some technical glitches like they always happen in live events. So hopefully you're understanding. Chat with the other doctors in the chat roll. Let them know it's live. It's not a recording. We decided to hold this broadcast to answer your questions. Anything to do with implant dentistry, specifically the surgical aspect. We're going to be talking about how to build implant sites, talking about the bone grafts that we're using. Doctors overwhelmed me with so many emails, and I felt the better way to address that was to hold this live. So everybody in the dental community that is awake right now can watch, can learn, can bring their practices into the next level of surgery. And I want this for you. So again, we have Dr. Rashad Ryman here. How are you, partner?
Excellent.
Great to see
I'm
you.
happy to be here and to share this message with the world, because God knows there's a lot of dentists out there who would greatly benefit from this. I know I did.
Yeah, I mean, there are a lot of dentists and there are a lot of patients, even more patients.
More patients.
We now have about 2 million dentists in the world, not a whole lot, out of 7 billion, 7 billion people. And now, at least in the US, we are in a situation where we have over 200 million patients that are partially edentulous, that need implants, can benefit from implants, and this number is expected to grow. So we want every dentist that is interested in incorporating implants in their practice to be ready, because there's going to be actually a huge influx of patients coming into the practices, and we pretty much have to be prepared. So,
and we're seeing it. Last Saturday I had an amazing day. I did 3 surgeries, 3 post-ops, and 3 deliveries of implant crowns. So doing that, going to work and actually doing surgery and feeling comfortable doing implant dentistry and handling complications when I get bone loss, or being able to present implant dentistry to patients and have them trust me to do it as a general dentist, I wasn't initially empowered to do that. But I think what's happening at Surgical Master, the gift that you're giving to people, to dentists, the empowerment, it's not just knowledge, the empowerment and the coaching and mentoring is turning the needle for a lot of dentists. For me, for sure. So it was nice. I went to work, did a bunch of surgeries, and came back. It's a breather away from a lot of insurance-based dentistry, a lot of HMO type of sell. You see, surgery is a highly needed skill. And when I developed myself as when I developed my skills in surgery, I became much more attractive to other dentists who own offices, who want dentists to do implants there. So I love it.
That's great. No, really the reality is, and for somebody who's been doing this now for almost 20 years, there is something exhilarating about performing a great surgery, having a great performance and accomplishing a task. It's very different than restorative treatment, 100% different, because what you're doing in surgery is your own creation. You don't depend on any lab work. You're not depending on color matching. I mean, you can match the tissue, but it's really your own creation. And when that works out, it's a wonderful feeling. And now we see that many general dentists are starting to perform their own surgeries and starting to place implants and doing bone grafts at a very high level. We also have a lot of specialists in the big cities and the big communities, and specialists have their place. I'm a specialist myself practicing here in Beverly Hills, California, but in reality, what I'd like to for every dentist is to practice what they feel comfortable. And really the comfort or the confidence comes from knowledge, comes from starting to make the initial mistakes and some of the initial mistakes that you'll be making, correcting them, fine-tuning your problems, and then reaching a high level. And really the education never ends. It's just a never-ending process that you will go through. It's like one of those hills that you keep climbing and climbing and climbing and kind of enjoying this process. So I love being here. I love being here with Rashad. We have a great team here that will monitor your questions. So put questions below. And maybe we should just start with one question. Let's start with one of the first questions that came about. Let's see. Okay, let's start with densa burrs. Okay, so Michael, let's go to the screen. Okay, let's see. So the question is, what do you think of the densa, also densifying burrs for thin ridges? Okay, that's a great question, and we're now seeing a lot of continuing education, a lot of lectures and courses. One of the best ones is led by my good friend, Dr. Ziv Mazor from Israel, talking about the densa burrs and showing doctors what this technology is all about. Now, we're not all up to date, and one of my plans for this year is to incorporate densa in my practice, and I wanted to talk a little bit about that. So basically, the idea of the densa burrs or densification is using the implant drills that have a very specific design in reverse, still in high speed, in high RPM, in reverse. And by using it this way, the burrs themselves condense the bone and can even expand that. So the final outcome is that we're getting high torque values on placement. We're getting ridges that can be widened, and basically solving the bone quality problem that some doctors are having. Now, the idea here is it's not that you can take any burr of any system, just put it on reverse, and it's going to be densification. Okay, that's a misconception that a lot of dentists are having. You need to use the specific burrs by this company that currently is proprietary. And it's a wonderful technology. I don't have the experience myself, but one thing that bothers me personally, because one of the doctors asked about this technology, it works great. It allows you to place implants in narrow ridges. It allows you to densify the bone, increase the bone quality, and place implants with initial high stability. That's a great thing. But the inventor of the system said very clearly in his lecture, and I listened very carefully, said, don't use the system in guided surgery, meaning using a computer guide and creating your osteotomy fully guided. The densification burrs will not work with computer guided surgery. So I'm only quoting the company. Okay, so if there's anybody from the company, from what's the name of the company? Densa. Okay.
Densa.
Densa. Okay, so if there's anybody from the company, anybody who has the experience with the densification burrs, do you have the experience with guided surgery? To my knowledge, and I heard it with my own ears, it's not possible. So that's one drawback that I have, because I like to place all my implants fully guided, and that would be a downside for me. Number two, what we need to keep in mind is that we don't always need our ridges to be expanded. We don't always need to build up more bone, and quite often we don't have problems with bone quality. So I don't see the value of using the densa burrs in areas where you have enough bone and where you have good bone quality. I don't see a tremendous benefit. Actually, quite the opposite. Some dentists are getting into quite a bit of trouble when they're reaching higher torque values that are too much. So when you placed, you had a great day on Saturday.
Yes.
Okay, this past Saturday.
This
okay,
past
great.
Saturday.
I was swimming and you were working, so that's great.
I was doing something I love.
Okay, well, I needed to take care of my kids.
Yes.
That's the difference.
That's what matters.
So when you placed your implants, what was the torque value that you were aiming for?
35.
35.
Yeah.
So meaning what? So when you placed your implant, you looked at the torque values, and how did they feel at 35?
I usually don't like to go higher, just because I know that I can choke off the blood supply.
Okay.
And I've seen lots of bone loss, and supposedly that's because it's over tightened. So
we by the way, we don't know this yet.
we don't know it yet.
We don't know this yet. What we know is that bone technically can have overcompression necrosis. That's what we think. We don't know.
Okay.
But in my clinical experience, if you over torque an implant and it starts to squeak, and you start hearing the squeaking of the instrument, and it feels tight, and your biceps muscles are getting bigger and bigger, you got to stop.
Yeah.
Because you're increasing the torque values. Now, what happens, some implant systems can afford to have higher torque values, because we know some implants can even break. But I don't recommend you go with any placement in any position in the mouth to a very high torque value, even if you immediately load.
Yeah.
So when I mentor dentists about their torque values, we don't always have control. So what you'll do, you'll set the machine to a certain torque value, let's say 35, if that's the number you're comfortable with. And you drive your implant in, and it's going to go in slowly, and it's going to stop when the torque reaches 35. And then the rest of the torquing is done manually.
You know what's been a challenge in this journey of mine in implants? Getting the osteotomy to a place where when I go ahead and put the implant, it's totally submerged by the time it hits the 35 torque. A big challenge is I do the osteotomy, I go to place the implant, and halfway it's not going down anymore. So I know I under-prepped my osteotomy. It feels uncomfortable to take the implant back out, put it on, it's like this thing is exposed.
Common problem.
Yeah.
And it happens even if you follow the same the recommended protocol. So this is what I recommend. I mean, this is common. This happens to me, by the way. The implants get stuck in the middle.
Do you put it on the side?
So this is what we do. So you set the machine to, let's say, 35, 40 Newton centimeters. You drive the implant in. It gets stuck halfway. What you don't want to do is keep torquing it in. Something is going to break. Your torque driver, your implant, the bone is going to get damaged. Simply put it on reverse. You'll have to use a torque driver because the machine already reached 35, 40. Actually, you can dial up the machine as well, but I like to reverse it with my hand torque driver. Then put the machine on reverse, on, let's say, on 45. Reverse the implant, put it back in the package, and then use a hard bone protocol. So you may have to use an extra drill. You may have to use a tap to create threads in the osteotomy, and then go back to the same implant, replace it again, and then look again and see if it reaches the ideal height. Ideally, it should get to 35 shortly before the bone. Shortly before, and then your hand torque is just the final confirmation. And I'd like you to be able to use a torque driver that has a torque reading. Not all of them have that. So you'll be able to see, is it 20, is it 35, is it 40, 45, and some go higher. But that's usually the range. So you did the right thing. Don't drive it in if it's stuck halfway.
You know, I learned from someone else's mistake.
Okay.
Someone was putting in an implant and they used their biceps too much and it broke. So
the implant broke.
the implant broke. It was
That
actually
happens.
on a relative of mine, and
Sorry.
yes, so the dentist, I don't think he handled it well. He told him I'm Hercules, so the patient was like, "Well, don't be Hercules on me."
Got it.
So that goes to show that when it's not going in, there's a certain protocol to follow.
Yeah, absolutely. I mean, the torque is important. Initial stability is important, but you don't have to have 90 Newton centimeters for an implant to integrate. Actually, this is more damaging. You know, between 20 and 35, 40, that range, the torque values are enough for integration and also for loading.
What if you over prep and it just goes in and the torque is 15?
That happens too.
That happens.
And it happens too also in soft bones. So I typically have a backup implant. So the next size up, if there is a next size up, should fit in there with the right torque. It's what we call a backup implant. So you always want to think, what if I over prep? What if the bone is too soft? Then you want to go back in there and put the extra implant. Once you over prepped and your implant is completely loose and spinning and you used your backup implant, you tried the backup plan, that's it. You're done. You abort the procedure. You graft, you do what you need to do, complete the case, and you come back another day.
Have you placed even with that and have it integrate, even if it's over prepped and loose?
No.
No?
Loose implants should not be left.
Should not be left.
When we say loose, this means loose. Okay, the implant is completely loose in just osteotomy. That will never integrate. It will just encapsulate. But implants that had achieved torque values of 10, 15 Newton centimeters did integrate. I didn't load them. I may have submerged them. But I aborted cases as well. Sometimes you need to abort. Okay, so let's talk a little bit about other questions.
Yeah.
Okay, let's see what else we got there. Okay. Okay, so let's go to the computer. Okay. So the question here is, are you using a xenograft, for example, BIOS for GBR? Okay. Good, great question. Great question. In the past, I only used BIOS about 20 years ago. Only the BIOS products and the BioGuard membrane. That was one of the only materials that we had available and were working. But as time went by, BIOS fell out of favor a little bit as a bone grafting material in terms of sockets, in terms of building ridges. But the nice quality about BIOS that I really love is that it resorbs very, very slowly. It's the way they make this material. It's xenograft, meaning it comes from animals, from cows. And they're sintering the material in very high temperatures, okay? And what happens, it resorbs very, very slowly. So in that sense, it's ideal for GBR, for grafting bone around an implant, or creating what we call the contour graft. So if an implant is deficient in bone and the bone is relatively thin, you use a xenograft, and that has a better chance of staying there and maintaining the volume. Now, it's not real integration, but it keeps the volume of bone, that keeps the tissue, that allows you to have a better emergence profile, which is really nice.
So the BIOS, if you go in earlier, it's like pudding. Does that mean if you leave
pudding
it,
you don't want to eat?
You don't want- no.
It's not something that we like. It's like mush.
it's mush?
You want to go to show one of your cases?
Sure.
Yeah, that's
Yeah.
actually, we have a BIOS case here. We're not in a vendetta against BIOS, guys. Okay, BIOS company. It's not against BIOS. We are sharing clinical information, clinical knowledge that we have accumulated over the years, and we want to share this with you, so you too can use this information. Okay.
We don't want people to, I've been having a lot of BIOS problems lately at one office, and once you told me, hey, don't use BIOS for grafting inside the socket, use it for contour graft sinus, because it takes a long time to mature. We actually stopped doing it, but we're still in the process of cleaning out a lot of cases that were BIOS, where the results were like pudding, and it's a big loss for a practice to have several patients coming back where you have to regraft the site. So it's a great thing, Ziv, to what you do to spread the word so that dentists don't have to face a type of loss like that, because it is costly.
Yeah, we can go to the screen. Is that your BIOS case? Is
Yes.
that the one? Okay, good.
Yeah.
What was the story here?
So this
We can go back. Here it is.
this case, the patient came in maybe 4 or 5 months ago. They had the tooth extracted by another dentist. The dentist used BIOS there, and the patient was scheduled with me to have the implant placed over there. So I reflected the flap. Before I reflected the flap, I was giving anesthetic, and I noticed a bubble happen on the buccal. So I'm like, okay, so there's a communication. There's some kind of fistula there. So I reflected, and I went in, and the whole socket was mush, and there was actually, where that fistula is,
Okay.
if you go to the picture, you'll see that there's a window at the side there. So that infection didn't heal. Something happened where there was a connection from the side. So what I did, I cleaned it all out, and I had the decision to make, which is, should I place it or should I not place it?
What you decide?
I ended up placing the
Okay.
implant.
Is that the case here?
Yeah, that's the case.
So what was, before we go to the case, Michael, I wanted to ask Rashad, what was your kind of thought process? Like, obviously you had a dilemma,
Yeah.
because it was not an obvious decision. When you see a case like that, okay, when you see a case like that, when do you decide, okay, I'm going to go for it, place the implant, or I'm going to, what we call chicken out, okay, and abort and come back another day?
Well,
And by the way, no problem to chicken out, okay? It's okay to chicken out sometimes.
chickening out is one of the bravest things you can do that can save you a lot of headache, and I learned that the hard way.
Okay, you got it. You got it. So what was your decision making? What was your thought process about when you were in this type of situation?
Well, I remembered your words, no buccal wall, no immediate implant. So here I still had a buccal bridge. If you look at the clinical case, I still had a buccal bridge of bone there. So I knew I had some support, so that was my decision. Since I had a buccal bridge that was remaining there, I decided to place it, because after I placed the bone graft, I know that the tissue was supported and it wouldn't collapse.
Okay. I think you made the right decision. Obviously, this implant worked. And I wanted to give you a little bit of guidance
Sure.
about, let's call it mindset or thought process, because let's go back to the slide. I would have had the same dilemma like you. Should I place or not place? So in your mind, you don't have to commit to placing it. What you can do is commit to creating an osteotomy. Okay, you don't have to have a mindset of, I got to place this implant. Like, I have to make my quota. I have to produce. I don't want to disappoint the patient. I don't want to disappoint myself. The patient came for an implant. I want to do it. That mindset you have to get rid of, because it's going to put a lot of pressure on you, and you're going to make the wrong decision because you're trying to satisfy your ego, because the patient came to see you for an implant. You don't want to disappoint them. So the mindset should not be like that. The mindset is, okay, we have a challenge. There is a relatively small fenestration. Let's create an osteotomy. Step one. Let's create an osteotomy that's in the right position. Let's see if we have some apical bone. Maybe the apical bone sucks too.
Yeah.
Maybe the whole site is messed up. Then why put so much stress on you? You placed the implant, you created your osteotomy. It's not always simple because you're only drilling at the apical part. So from a mindset point of view, think about it like an immediate implant. I know it was delayed, but from your own kind of how you consider it, look at it as an immediate implant, create your osteotomy, then place your implant. But no pressure, because this implant may not reach stability, may not reach, grab stability from the palatal plate, from the apical portion. So then you place your implant. It reached enough torque values, good initial stability. Then you make the third decision. It feels good, it looks good, it's in a good position. I can graft around it. It's a well-contained defect. You can go back to the slide. I can graft around. I can place a membrane on the buccal. I can close the site primarily because it's a delayed site. Less pressure on you.
And what you're saying is golden. For a general dentist who wants to do implants and commits to doing implants, I'll tell you from a general dentist perspective, if I go in initially, before I was being mentored by you, if I go in and I feel like, oh my God, I used to have that pressure, you need to do this. You're not because there's some sort of weakness that we general dentists have just because we didn't specialize. So we think, well, a specialist would have done it, why not us? But after I had the pleasure and I'm grateful to have come across someone who was open about knowledge like you helped me shape that mindset in my head, like, hey, it is totally okay to abort a case.
100%.
It's intelligent actually to do it for everyone's benefit. So thank you for that. And I think that's a huge message that people out there should really understand. It is totally okay to abort. And now what I tell patients, I prepare them from the beginning. How you guided me. I tell them, look, we're going to go in there. If things are not looking in a favorable way, we're not going to put this in. It's for your benefit. And I've accomplished a level of ease when talking to patients just because my mindset, just a mental shift. And that's why I believe mentorship is incredibly important.
Yeah. I mean, you see, I started as a general dentist, and I had mentors. I was mentored by specialists. I was mentored in a university setting under the protective umbrella of a university. So I was taught. Now, some of these techniques I developed myself. I learned from other doctors, but the case that you just showed is pretty common. It's pretty common. The bone for an implant site is very rarely optimal. Even in spite of grafting, in spite of everything that we do, it's very rare for me to place an implant and saying, wow, I have too much bone. Bone is always lacking. So I'm glad you went through this experience. Okay, we need to learn. Okay, so let's look at some questions. Do we have some questions on Facebook? Let's see what we have there.
Let's see.
Let's see, and I'm going to look at mice. So Michael, let's go to the screen, and still talking about BIOS. Here's another interesting question. Do you get a foreign body reaction if you use some bone grafting materials without a membrane? Interesting question. So foreign body reaction. And that's what's so interesting. And I don't want to get too much into histology and scientific stuff. This is a clinical broadcast, but it's very interesting to see that some of these bone grafts, once you look at the histology and you see the different cells, some are called the osteoclasts, or the giant cells, the multinucleated cells. And there would be one person looking at the histology saying, this is bone remodeling and this is healing. And one other person will look at it and say, this is a foreign body reaction just based on how the cells are looking. So when we talk about foreign body reaction, on the cell level, you'll always see it. You'll always see the body trying to absorb what's not theirs, trying to eat away necrotic bone, whatever's not supposed to belong there, and heal. Now, this has nothing to do with a membrane, whether you use one or not, because the cells are coming from the circulation. They're coming from within. So what I think you need to think about, the doctor that asked the question about the membrane, is why are you using a membrane? What's the reason? Why do you pick one membrane over the other? Why do you use collagen that is resorbable versus a titanium or EPTFE membrane, metal reinforced, titanium reinforced? Don't think so much about a foreign body reaction, what happens to the cells. Although it's very interesting, think about the clinical benefits. So in my philosophy, I use a membrane as a containment mechanism, because when you place bone grafts that is usually in particles, they go all over the place. Whether you're grafting a concavity or you're grafting a type of defect that you just showed, these particles are going to go all over the place. By the way, did you use a membrane?
No membrane.
No membrane, okay. You use the periosteum as a membrane,
yes.
Okay? That's another dilemma. So I would have used a membrane, because that ensures that these particles are not just traveling all over the place. And it's not a guarantee, doesn't exclude any cells in my experience, but it contains the bone graft that you want to have there. So just think about it remember the compartment technique.
Mm-hmm.
Think about a socket or a ridge in compartments. One compartment is missing, the membrane is the artificial wall, so it contains the graft. Pretty clear?
Clear.
Clear.
We have a question from, all right, we got a question from Haidar Al-Tamimi.
Yes, sir.
What type of implant and surgical type? So I guess Haidar wants to know what type of implant you use and what surgical.
Fantastic.
I'm not sure what he means by surgical type.
Okay, very good. So probably what type of implant. So I've used all types of implants. I've used all the implants on the market of the leading brands, and we know who the leading brands are. Nobel Biocare, Zimmer, ITI, Straumann, which is ITI, BioHorizons, Astra. All the big brands I've used, they all work the same. They all work the same in terms of the success rates in my hands, in my practice, using various scenarios. And I think most doctors in the world would agree that implants work exactly the same. Okay? The difference is the operator. The difference is the clinician, how you use them, and your surgical technique, your flap reflection, your site development, what I call the implant site blueprint. If you have the blueprint of what works to build a site with good bone and good tissue, you pretty much got the secret for dental implants, because if you can't build an implant site, you can't place implants. So the type of implant does not make a huge difference. I personally like to use a type of implant design that is more tapered for initial stability. I like to use a platform that has a conical connection and a platform switch, okay? And I like the threads to be not too aggressive. Again, my experience is not a problem with bone quality. and I'm not saying there are not problems, but bone quality is not a major issue, even with immediate loading. So for us to use aggressive threading, compact the bone, and maybe create some over-torquing, over-pressure, you know, it's a balance. It's not cut and dry. Okay, what implant am I using? Look at all my presentations. They're mostly Nobel Biocare, they're Astra, Zimmer, Bio, all of the above. I used all of them because as an educator and as a teacher that likes to explore, I wanted to try all of them, and they all gave me the same results.
I know you you mentioned one point of developing the implant site, and I
Yeah.
know in the upcoming implant accelerator
Yeah.
course, you're going to be sharing and training on that key element. You know, when I first started learning implants, the idea of tissue and all that was not very clear, and I still see it. I still actually
Okay.
experience where I see other dentists that are placing implants and restoring them with mucosa around it. It's
Okay.
just incredible. So I know you're going to cover that in the implant accelerator course.
Yeah, absolutely. I mean, that's exactly what I said before. If you want to be excellent with implants, not just mediocre, good, just getting by. If you want to be excellent, because that's something that we all want. We all want to reach a high level of success. Okay, don't be a bottom feeder. Okay, we want to be on top, the top of the food chain. You need to be able to build implant sites. What's the point in taking an implant course or let's say an all-on-4, an immediate placement, socket shielding, if you don't know the basics of how to build a good implant site, not just a ridge that will give you all that. So that's really the first topic that I'm going to tackle in the implant accelerator coming in November. Okay, we just opened registration, like you know, and we have lots of doctors already registered. We still have some spaces left. The first day of the implant accelerator program in Beverly Hills is going to be dedicated to the implant site blueprint, okay? Blueprint.
What's a blueprint?
Blueprint, okay? We follow the blue. The blueprint is basically the protocols and strategies that the top surgeons use. All the cases that you're seeing on Facebook, my cases, other cases, where you see abundance of bone and great ridges, what is behind them? What's the story of how these were created?
So you're saying that if I'm a general dentist and I want to get into implants, or I'm already doing implants, you're going to be teaching the way that Ziv Simon thinks through his mental process on how he diagnoses and what steps he takes to make sure that he has the best implant site. And you're saying the blueprint, it's a systemized process?
Yeah, the blueprint really starts from understanding what you're trying to achieve. What site are you trying to rebuild? Is it a central incisor with a high emphasis on aesthetics and height and emergence profile? Is it more in the posterior region? So I'm going to go over that. And really what I'm going to teach is the three main bone defects that dentists see every day, and that is the concavity, that is the vertical defect, a combination defect, and fenestration that we all see all the time. And by knowing the blueprint and knowing the strategies, you maximize the chances of your success. You can never guarantee how a site will behave.
And you know what's important about a blueprint? To me, when I treat patients, and to a lot of dentists out there, I think, I want to make sure that I'm giving them the best in the standard of care that exists. And as a general dentist, I've always had, before I started this journey, I always had a doubt in my mind, am I doing the best for my patient? And I feel guilty that maybe I'm not. So by having a blueprint, by having, hey, this is what Dr. Simon would do, in this case, I am put at ease knowing that, you know what, from the current body of knowledge that exists in dentistry and in science, this is the standard of care. And that's a huge gift that thanks for sharing it with all dentists.
Absolutely. And,
Yeah.
and I'm not going to share things, Rashad, crazy cases that are not predictable.
Yeah.
Where I just stuffed a bunch of bone and put a bunch of membranes and I did heroics. Because there are some heroic cases that work every once in a while. What I'm going to be sharing is what I do every day.
Bread and butter.
Bread and butter. Yeah, every day day in, day out, what I do, how I do it, what materials I use, and that's why I call it the blueprint, because it got to a point to when you keep doing the same thing over and over and over again, and it's successful,
There's a pattern.
you see the pattern.
Wow.
And you create almost like a code. So we kind of codified the bone grafting process.
The matrix.
The matrix, exactly. Okay, the matrix is going to start kicking everybody. So that's the first day of the Implant Accelerator course. Okay.
We have a question.
Okay.
Maybe, and that's something that. So, I recently was putting in an implant in a mandibular second molar, and after giving a block, the patient was in tremendous pain while trying to drill into the bone. Why is that? I know starting out I experienced that, and every once in a while I do experience patients having pain, and it is scary because you're like, oh my God, am I drilling into the nerve? And sweat breaks.
Of course, it happens.
That happens.
And it happened to me too.
Yeah.
It happened to me too. So basically, it really comes down to local anesthesia. And I'm assuming that the doctor who asked the question did all the CT scan analysis and saw where the nerve is traveling and figured out, okay, I have enough bone, there's no double nerve, there's no accessory innervation in terms of the inferior velar. Okay? So when the patient feels pain, it is possible that there is accessory innervation from the lingual aspect. So the number one thing that I would do is re-infiltrate on the buccal and the lingual and re-block. I don't know if we want to get into that, but we already talked about the question whether you should block or infiltrate when you're placing an implant in the posterior mandible. And I said very clearly, you should be blocking and infiltrating and get your patient comfortable. Because if you're relying on your patient, and maybe I should mention that because not everybody saw the video, there was a common dogma in the past when I trained, and you probably learned the same, when you're placing an implant in the posterior mandible, hey, don't block. Just infiltrate buccolingual, anesthetize the soft tissue, because when you get close to the nerve, your patient will say it hurts, and then you'll know how to stop, okay? Doctors don't do that.
That's walking on the edge.
It's walking on fire. Okay, don't do that. If you have to rely on your patient to tell you that it hurts, so you know that you get closer to the nerve, you shouldn't be doing the case. You don't have enough analysis. You don't have enough leeway. So make sure you do all the analysis before. Make sure you have enough bone. Make sure you're drilling to a very specific depth, and know that you're not reaching the nerve. Now, if the patient feels some pain, it's coming from the soft tissue. Okay? So I would, first of all, when this happens, to answer the question, when this happens, stop. Number one. Don't keep drilling into the patient's jaw when they're having pain. Common sense. Like if you're doing a prep and the patient says it hurts, what are you going to do? You're going to stop and say, sir, what's going on? Let me check.
But you know what happens, Ziv? I see a lot of patients who come in, the dentists don't stop, and they keep working. And I think that's something that you teach. Mm-hmm. Before I think you start doing these things, there's some core things that you can do to build your reputation. And
okay, core things. Okay, here's the core thing. If you're a dentist, don't cause pain wherever you can.
Yes.
Don't cause pain. So if you want to be good at one thing as a dentist, be good at local anesthesia.
Yes.
I may not be the best, the most gentle injector, okay? You're much better than me in that sense. But I make sure that my patient is fully anesthetized and has no sensation whatsoever. They'll feel pressure. They'll feel some vibrations, but no pain. If you have patients that feel pain, you will not have patients. They'll never come back. They'll run away. And especially something like a surgery, in the old school dentistry, dentists would say, I'm almost done. I'm almost done.
One more minute.
One more minute. And it's actually an hour. So
One more minute of torture.
no, don't do that. So the first thing you do, check that, first of all, stop, number one. Then check the effectiveness of the block. Okay? So you want to check the corresponding lower lip. You want to check the corresponding left or right side of the tongue. You want to check the soft tissue with a probe, go in there and infiltrate more. Use articaine. You know, make sure that your anesthesia is effective. If that's it. We can stop the broadcast, because that's really one of the most important things.
And I know in the implant accelerator course, you have a blueprint for actual anesthesia and how to make sure that whoever's doing implants, they got that core thing covered.
Yes, absolutely. Because I figured when I created this course, if I just teach technique, and if I just teach, okay, step 1, step 2, step 3, 10 steps, 20 steps, and that's great, and you can follow that, but your patient is screaming in agony, so how is that going to help you? Okay, you're not going to be a good surgeon, because this patient will never come back. So in the implant accelerator, you're going to learn start to finish what you need to accomplish as part of a procedure. In this case, we're talking about implants. We're going to talk about bone grafting. We're going to talk about specialized procedures. That's on day number 3. I'm going to talk about the magic bullets. So in these types of situations, you need to know the whole case from start all the way to completion. Okay?
We have a question from Dr. Moshi Rechthand. Hi Ziv, do you use a papilla sparing flap for anterior implants? Question mark.
Okay, great question. So a papilla sparing. Just so everybody on this broadcast knows, is when you're creating a vertical releasing incision away from the papilla and reflecting a full thickness flap. And the idea behind it and the hope behind it is that when you spare the papilla, that it'll never go away. And we all know about the importance of the papilla. So the answer is yes, but not for every case. Not every papilla can be spared. And one of the examples is that you are working in a very narrow space. If you're going to try and spare the papilla on both sides, you will not have enough room to place your implant comfortably. And then you'll be damaging your papilla with your implant drills. So do a very simple calculation, okay? Measure the ridge mesiodistally. You already know what's the implant diameter that you're about to place. See what's left. And when I spare papilla, I'd like to have at least 1.5 millimeters of papilla spared, and ideally 2 millimeters, okay? So I hope this answers the question.
Awesome, thank you. So
Okay.
basically, measure the space, and if you can spare it, spare it.
And you spare it if you can, but not for every case.
Not for every.
Not for every case. If the papilla is gone to begin with, what are you sparing?
Yeah.
Okay, what are you sparing? Okay, so let's not be dogmatic. Let's just think. It's not all cut and dry. Meaning every case is the same. You always do a sparing, papilla sparing incision. It's not always the case. Every case is different. So, what I encourage doctors that work in mentor, like you do all the time, let me look at the case. Let me get some information behind it, and let's decide if a papilla sparing incision is a good thing. I several times made a papilla sparing technique, used it, and I regretted it. It was a mistake because I didn't have enough room to place my implant. It basically limited my bone grafting ability, and it's not for every case.
One of the awesome things, Ziv, that you do, it's quite simple, but you strategize flap design for cases. And as someone who gets mentored by you, and I see you mentoring other dentists on it, a proper flap is the difference between success or failure.
Wow.
So just, having access to you to actually help out and shed light on proper flap design on a case-by-case basis has done wonders for my practice.
Yeah. So just kind of, just to enlighten us a little bit and know about the possibilities, and let's talk about just a little bit of schematics. If you're looking at a ridge, this is just total schematics. Okay, this is your ridge. And you're planning to place an implant in this location. We have so many different options. Okay, first of all, we can use a flapless approach, right? That depends on how much soft tissue we have. We can make an incision, and let's erase this for a second. We can make an incision, and if these are the adjacent teeth, okay, these are adjacent teeth, we can make an incision that is mid-crestal. Here's buccal. We can make the same incision more to the palatal. What's the advantage in that? We are preserving all this tissue. We are mobilizing this tissue to the buccal aspect of the future implant. We can use a papilla sparing technique. Okay? We can use a papilla sparing technique. So we would make a vertical releasing incision all the way to the buccal and spare the papilla. And I mentioned before, you want to have about 1.5 millimeters to 2. Okay? Now, we can combine all of the above. We can use a half punch technique. So that means that we'll punch only this part of the tissue and not reflect the palatal flap and only reflect the buccal flap. We can do one vertical releasing incision and leave the other one just as a full thickness. So we have so many options, and what I find is a lot of doctors, and including you, Rashad, sometimes get a little bit confused and like, okay, so what do I use next? Do I use the half punch? Do I use a sparing? Do I go more palatally? And I always answer with a question. Okay, and I'm never trying to put anybody on the spot. Okay, we're working together as a doctor that wants to be better, and as somebody who has done it more than you. Okay, a couple of years more. So the decision about a flap design is not random. Is what are you trying to achieve? If this site is deficient in tissue and has some bone problems, and you're planning to graft, obviously, you will not go with a flapless approach. Obviously, you want to get more tissue. If you're planning a one-step approach with an immediate provisional or healing abutment, you want to use maybe a palatal approach of the crestal incision. If it's the aesthetic zone, maybe use the papilla sparing technique. So the decision on the flap design is determined by the incision design that comes from your thought process, what you're trying to achieve. Now, if you have a huge ridge, this size, it doesn't matter. You don't need me for that. But it's always the question of those ridges that are slightly collapsed. Okay, what do we do here? How can we take advantage of the soft tissue? And that's really where the thinking comes into play. And a lot of doctors are becoming robots. Not in a good way. Robots are great. We know that they perform many times better, but they become very dogmatic, very much in the box, and they're not thinking, why am I creating these incisions? So that's my job.
I know in the upcoming course you will be quote-unquote programming dentists on the mindset to actually be able to independently make these decisions, and that's amazing.
Yeah, I mean, what I'm teaching is not rocket science. It's not, it doesn't require a tremendous intellectual thinking. It's really based on my personal common sense. Okay, what is common sense? Common sense is you are placing implants you want to have good bone and good tissue, this is how you get. These are the couple of ways. And this is the best way, this is the second best way, and this is the third.
The devil is in the details.
Details.
And you, Ziv, teach the details extremely well because you're just a detail-oriented individual.
I'm a little bit OCD, so that's why.
That's good for a dentist.
That's why.
And speaking of robots in China, you saw that video where you think that robot in China will be able to assess tissue quality and all that? And who made the incision? That's an interesting.
I think the robot that they showed, and I just shared your post, by the way.
Yeah.
Okay. And it kind of got viral, and all the dentists like, oh my God, the robots are taking over. This was a huge machine that probably cost like $10 million. And which site was it doing?
It was like a front here.
A front.
Yeah, like a
front. With the posterior, you don't have access. You don't have access. So I believe that these robots are far from taking your job as a dentist, as an implant surgeon. I don't want you to worry. I'm not worried one bit. I think it's fascinating that it is possible. And we don't even know what was the outcome. We don't know the outcome yet. But I think it's fascinating, not concerning to anybody. Actually, we welcome technology. We welcome artificial intelligence because robots and digital systems, computerized systems are going to help us make better decisions. And we see this already today with CGI, with computer-guided surgery. We now know that our implants are going in much more accurate.
Thank you, Ziv. Thanks for everything you
Sure.
do. We got a question from Dr. Denise Silva. What could I do when a buccal bone plate does not exist?
When it doesn't exist, like every day, like all the time. Okay.
Like, yeah, a lot of times.
Buccal bone doesn't exist because there was an infection or it broke off during the extraction. Well, if it doesn't exist, then we have a problem because we cannot have the site heal itself. The defect, if you think about an extraction socket as a space, once you're missing one of the walls, which is, and the buccal wall is one of the most important one, the site will collapse. So you need to find a way to graft the socket and use a collagen membrane or another membrane to make sure that your bone graft is contained. And that's really the bottom line. You need to find a containment mechanism to help you graft the site. My recommendation, and again, this is the mantra that I'm repeating that I already brainwashed Dr. Ryman and a few hundred dentists. If you're thinking about immediate placement and the buccal plate is not there to begin with, or it broke during, okay, things happen. Don't place an immediate implant. My word of advice, it's not predictable. You can have a total collapse of the tissue. It may not work. So the mantra is
No buccal plate, no immediate implant.
No immediate implant, okay, almost together, okay. No buccal plate, no immediate implant, okay. We should put it like as a title slide. Okay, let's go to some more questions.
We have Dr. Maria Filomena dos Santos.
Wow.
It's in Spanish, so I'm going to have it translated,
Please.
then we'll come back to that.
Please.
We have we have a question from Dr. Stephen James. Do you use a lot of cone beam radiology to plan implants?
Okay, fantastic question. Absolutely. Cone beam radiology, meaning I use a cone beam, meaning I use CT scan technology to plan my implants. I use the guided philosophy in every implant case that I do. It doesn't mean that you need to apply guided surgery in every case, but absolutely, because there are so many things that you will not see without evaluating the third dimension. You will make better decisions about implant positioning. You will see spaces, anatomical, just deviations from the normal anatomy. So the answer is absolutely yes, with a capital yes. I have some questions here. Okay, here's another question, Michael. Let's go to my screen. Okay. Are there any scenarios where you need to place the implant more palatally, hence grafting the palatal surface instead of the labial? Okay, great question. That's a fantastic question. So the buccal plate is the one that is the most susceptible to resorption. It's the one that is, I call it the troublemaker, because it naturally resorbs more than the palatal plate. It is thinner than the buccal and lingual plates. That's the obvious. But occasionally, there'll be circumstances or situations where a tooth has an infection that is draining to the palate, and the whole palatal bone is going to be gone or compromised. So yes, absolutely. I would use the same technique, the same approach in terms of adjusting my membrane, in terms of grafting bone, but it's a little bit more difficult. A little bit more difficult. Why should it be difficult? This is just tissue and bone, tissue and bone. What's the difference? Well, think about if you're losing the palatal plate, the palatal tissue is extremely rigid. You can't easily mobilize it. So you can't really have it stretched on top of the graft material if that's what you're planning to do. You'll have to undermine it. If it's the lingual plate, depending where, caution, the red zones, if it's a lower second molar, you're very close to the lingual nerve. You're very close to the floor of the mouth. You're close to anatomical spaces that some of us get a little bit nervous in terms of managing them. So the answer is yes, it's possible to graft lingual and palatal plates, but be cautious of the tissue quality, be cautious of the anatomy. I don't know if you ever had some like heart attacks when your elevator kind of went too lingual into the floor of the mouth.
Yes.
Like what we call a slippage.
Yes.
It happens.
It's happened, and it is scary. I checked. Hopefully, it didn't go too deep. Yeah.
Yeah, it's not coming up from here.
Yeah, we don't want it coming out from here.
Okay.
So,
Any more questions?
Maria Filomena dos Santos, her question was, what are the materials to make the teeth more resistant? I don't know if this applies here, but fluoride, Maria, right?
Okay. I don't know anything much about
I'm not
fluoride.
sure.
I'm sorry. I guess yeah, the answer is fluoride. But does she mean the mechanical? Because we're talking about implants in this broadcast.
Right.
Is she talking more about mechanical resistance of? I'm not sure.
So maybe Maria,
Maybe something got lost in translation.
You
here.
can yes, lost in translation. If
Your
you can
Spanish is not that good.
clarify, it would be great. Thank you for
Okay.
your question. We got placing a xenograft for socket or sinus material only and expecting bone in 6 months is not realistic. The material has a consistency of wet sand and cannot support an implant, not stable. It takes 12 months to form a solid mass. Where do you get the 12 months from? So I'm not sure.
Okay.
12 months is not a realistic time to wait.
Oh yeah. Oh no. Realistically, this is again reality. We are in private practice. If you tell your patient that from the moment they came to you, it's going to take a year and a half until they get the tooth, they'll go somewhere else, and rightfully so. So the sinus is a different environment. It's an environment that is the most conducive for bone formation. Why? Because it's a space that is on. Let's change that here. Let's make a little bit of drawing, couple of drawings here.
That's interesting. Why BioOS works in sinus, not sockets?
Well, it's not BIOS. It's everything works in the sinus.
Everything
It
works.
doesn't make any difference. The key for sinus grafting, if this is, let's do this. Let's be, okay. This is a ridge. Okay. So here's your sinus. Okay. And this is the membrane. Okay. We want to put an implant in here. Let's do this a little bit different. Okay. So this is the membrane right in here. Here's the floor of the sinus, and this is the residual ridge. So if we're planning to place an implant, okay, so here's our implant. We can actually do this. That's why we have magnets. Okay. So placing bios, an allograft, alloplast, almost anything is going to work. Why? Because on one hand, you have the Schneiderian membrane or the sinus membrane, and that's technically periosteum. It's a layer facing bone, so it's a layer that is also inductive. Inductive meaning encourages bone formation, de novo bone formation, out of nothing. You have bone right in here. Okay? And you have this environment well vascularized and closed. So this is the best chance for healing. So the material doesn't make a big difference. Now, are there some sinus grafts that when you go back, it's mush or it's sand? Yes, but these are the unsuccessful ones. Most of them are successful, and they heal much faster than 12 months. You can go back, especially if you have some residual bone. Now, some doctors are asking, why even place any graft? Why put anything in there? Well, one of the reasons at least in, again, primitive thinking, just simple thinking, if you put something in there, that's a mechanism of space creation. It creates your space. So it tends the membrane and bone will grow. Now, some implant designs are not so traumatic, so some membranes can be tented by an implant, but I don't recommend it to begin with. Why? Because safety. What if your implant does perforate? What if the membrane has a little tear to begin with or has some scar tissue and your implant just creates the final hole? So my preference is lift your sinus membrane with a bone graft material of your choice. Bios works great. Allografts work great. You want to mix some PRF in there, great. Here's a clinical tip. Anything you put in there, add tetracycline. Tetracycline inside. So you mix it up with your bone graft because, again, it's a closed environment. If it's a big bone graft, you may have some anaerobic bacteria starting to grow, and you'll start seeing air bubbles. So you mix some antibiotics in the bone graft.
Thanks for that tip.
Yeah.
I will use
Simple.
it.
Just a
Should you do tetracycline with all bone graft? Why not? What's
it
the
doesn't hurt.
drawbacks?
There's no downside.
No.
You know what the drawback is to get tetracycline. It's hard to get right now.
Wow.
I have a bunch. I can give you some, but
Thanks.
But it's hard to get right now in the United States for some reason.
And would clindamycin work or other antibiotics, or there is no studies on that?
That's
or
a great question, and I don't think there's even a study on that.
Okay.
But tetracycline works great. Tetracycline and also metronidazole.
So you just empty the capsule
Metron-
powder and mix it? Should you put a full capsule or
No,
half?
just sprinkle a little metronidazole. Okay, works great. Okay,
Awesome.
great. More questions?
What do you think about zirconia implants and what are its indications?
Okay, great question. Wow. Zirconia implants, the white implants. Well, zirconia, and there are only, I believe, 3 companies on the market right now. Zirconia implants supposedly, and I think research-wise as well, are more compatible with the human body. And I'm sure some people will shoot me for that, but we see some amazing results on how the tissue responds to zirconia. Not just because it's a white, it's not zirconia, it's zirconium oxide, which is zirconia. So it's a white metal. I think it's a great concept. It's a great concept, and I would have loved I would have loved to move into zirconia implants, but the problem is that the companies are currently offering only a one-step implant, meaning
One piece.
One piece. One piece. So that's number one. Number two, zirconia is harder than titanium. Stronger. But it's more brittle. So think about your zirconia crowns. You don't want to send them back and forth to the lab. You don't want to, polish them too much. Why? Because you're creating some imperfections. Very similar to glass. If you think about glass, glass is one of the hardest materials there is. Glass can be unbreakable. Now, you put, depending on the size and width, but if you put one scratch on a piece of glass, you weaken it tenfold. Just one scratch, like with a diamond. So my concern is what happens if these zirconia implants are processed in a way that there are some imperfections. And because most implants are made with a milling machine. And that's creating a lot of heat, a lot of grinding. What if there's some imperfections in there? But I think we'll get there at some point. And I think Straumann just came out with a two-piece implant, which I think is amazing.
Zirconium.
Zirconium.
Wow.
Yeah. So something to consider.
So it's harder than titanium.
It's harder than titanium. It's
and
white.
the body likes it more.
Supposedly, yes. And I've seen some amazing results from all the companies that are selling zirconia implants, and I will definitely be very open to trying them out once they move to a two-piece. What's the problem with a one-piece? Some people ask, what's the issue? So it's a one-piece, big deal. Well, it is a big deal because you are so committed to the angle. You can't really prep them. You could, but who wants to prep zirconia? Think about zirconia. Who wants to prep zirconia? So at the moment, I'm not going to use them. But I love the results that I'm seeing. I'm seeing amazing things.
Awesome.
It's coming. Okay, more questions. Here it is. Let me maybe go to my screen.
Yeah.
Okay, so here's a question. How long after a graft can you go back? Okay, it's right here on the computer screen. How long after a graft can you go back in? Okay, so great question. Again, not cut and dry. Okay, it's not one size fits all. I would say that the average re-entry is about 3 months, 2 to 3 months. And that may sound relatively quick to some of you guys. And it sounded quick to me, actually, when I started. I was taught to wait 6 months and 10 months and 12 months for sinus grafts, like the doctor was asking. But in reality, the sequence of healing, and Rashad, that's really important, because if you want to be excellent in grafting, you need to understand healing. Now, you don't have to be a bone biology professor and know the cells and know histology. Although it's interesting, but you don't have to know that. But you need to know what's the clinical sequence of what happens for an extraction socket. Mm-hmm. Okay, so if we just keep it really simple, once you condense your bone graft, let's call it time 0. You condense your bone graft, you grafted your bone with a, whatever bone graft it is, with platelets, with metronidazole, whatever it may be, that's time 0. That's when the blood clot forms and basically binds everything together. Okay. The second step, seeing the patient a week or 2 weeks later, you want to see some creep of the soft tissue on top of the socket. It's not there yet. It's kind of semi-open. That's where some people have some food impaction. That's when some bone graft material comes out every once in a while at 1 to 2 weeks. But as you get to the 3rd week, you should see complete soft tissue coverage. Okay, generally speaking, for most sites. If you're dealing with an upper molar, it may take 3.5 weeks, 4 weeks. But around 3-week time, you should see complete soft tissue coverage. And you know the first step of healing. You want the soft tissue to close up. It's not the most mature tissue. It's not the most resilient tissue, but it's closed. The bone graft inside takes a bit longer. It can take about 6 weeks, 8 weeks. And I start checking my sites for implants after 2 months. That's when I start taking x-rays. I start seeing the densification or the radiopacity or the radiolucency on a radiograph. And based on that, I say, okay, let's get a scan, or let's wait another month, let's take another x-ray, because again, we don't want to scan the patient too early and it's not ready yet. So how did I kind of find out about the power of what I'm telling you right now is I had a doctor, and I forgot his name. Shoot, I wanted to mention his name. A couple years ago, and I gave the same talk, the same explanation about how I place implants after 2 to 3 months. And he says, absolutely not. I'm waiting 6 months. I'm waiting 10 months. I want to be sure that I'm going to have a great implant site, and I don't want to go in after 3 months, and I don't believe this is true. And I said, okay, not a problem. But why don't you do the following? Why don't you, out of 10 cases where you place an implant at 10 months, take one case and go in after 2 to 3 months. See what happens, okay? So the same doctor attended another course. He says, listen, you changed my life. You changed my life. Why? Because I tried one case, it worked. I tried another case, it worked great. I'm going in sooner than later. And we're now finding out that you can go in sooner. It doesn't affect your success rates. Now, I don't suggest you go in 2 weeks later, but really by the book, delayed placement is now considered 2 months by the research. If you look at all the ITI studies, the definition of delayed placement is 2 months.
So after bone graft, they're placing 2 months, or after
2 months.
implant placement, they're
No,
opening?
after that was the question. How long after the grafting? So after the graft, waiting 2 months, going in with an implant. Now, is it every case? No. Most of the time, it takes me 3 months because I scan them at 2 months. Okay, let's say 8 weeks, 10 weeks max. And then it takes me a couple weeks to plan. Actually, literally, I go in at 3 months. Okay, now, some sockets take a long time to heal, and that's kind of the exception to the norm. If you think about a huge extraction socket where the extraction was difficult, the patient had tori, and you have it takes a long time. And then I'll wait 6 months. But that's more the exception. Okay,
Awesome.
so that's important to know these things. It may change your life. You may place more implants. Okay, like this doctor. And again, I forgot his name. Okay.
Dr. Walid Hanoun, what do you think about immediate implant?
What about them? Like,
I
should we
guess-
do them? Is it a good idea or not?
Do you do it? Do you are you a proponent of it? Should he do it?
Okay.
Is he taking more risk placing an immediate implant?
Great question. And I'm going to answer the question, but then I want to go to a case
Sure.
that a doctor sent me. Immediate implants work extremely well. They integrate at the same success rate, but they are much more tricky. There are many more pitfalls that you can face when you're doing an immediate. So my advice for Dr. Walid and other doctors, if you're just starting out, you're just starting your journey with dental implants, you're the first 10, 20, 30, 40, 50, you're just starting out, place them delayed. Place them delayed. Get comfortable with the drilling protocol that is totally different than immediate placement. Get comfortable with this first, and then go immediate. And let's go to the case because I can demonstrate it pretty well.
Awesome.
Okay, so let's. I'll tell you
Dr. Mark Pshara joined us. Hello, Dr.
Oh, hi, Mark
Pshara.
from Canada.
Yes.
Great guy. Okay, so here's a question that is kind of. Okay, we can go back to the screen. Mark, how are you? Thank you for all the great things you're doing at the Canadian Implant Network. Okay, I try to post as much as I can. God bless Canada. Okay, hope to see you guys soon again. So, I'm a periodontist. Okay, this is a question. I'm not going to mention the name here. I'm a periodontist and placed around 10 implants, meaning the beginning. And I don't know, I'm facing a problem with my angulation. And other than surgical templates and stents, is there any other tricks you can teach me to set my angulation right? And basically I asked him, okay, so tell me what is your problem with immediate implants? And he said, when placing the drill into the interseptal bone, it slips into the socket in immediate extraction and placement cases. And I place the pilot drill first, it goes wrong, and then I try to correct in the next drills, and this is what happens. Okay, I get my placement too distal. Okay, and here's another case he sent me. I start with my pilot, and I get a wrong angle. I try to correct it with the second drill, but then the implant is too mesial. Okay, I hope you can see that. So what is the problem here? What is the problem here? Okay, let's kind of go to the board for a second. Let's go to the board here. Let's erase that. Okay, alrighty. So we can go to the board. If this is your implant site, okay, this is your implant site, and this is number 19. This is number 20, and you're trying to place a number 18 implant. Your vision is blocked. Your vision is blocked. You're looking here. Here's the surgeon, right? Your vision is blocked. Okay? So what happens, it's only natural to drill like that. I exaggerate a little bit, but I've seen that too. Okay? And then your implants are going in like that, and it's too late to compensate, or like that. So you're blocked by the view. Okay? So what you need to do is have your assistant look on the mesiodistal direction, and you look kind of buccolingual until you find the right trajectory so you can drill. Okay? So you can drill in the proper angulation. Okay? Now, here's my advice to you, okay? And it'll blow your mind. It'll blow your mind. If you are a beginner with implants, don't place immediates. Don't place immediates and save yourself this type of problem. That comes later, okay? You'll save yourself a lot of problem. Like, wait for the site to heal, reflect a nice flap, okay? Spend the time working on the proper angulation, okay? Get your implant in the right position and the right depth, not to damage the nerve. And when you got this down, when you got the hand-eye coordination, your muscle memory in place, and you can now feel comfortable doing this drilling motion for a posterior mandible implant, now go ahead and tackle an immediate implant, which I also don't recommend for molars for this type of situation. Okay, there's a lot of things that can go wrong. Okay, but don't start with immediates. Okay, and you're going to save yourself a lot of trouble. Okay, so good luck with that. Okay, angulation is a huge issue, and we're going to talk about it in great detail at the implant accelerator, because again, you built this beautiful implant site. Day one, we're going to work on the implant blueprint. Then the second day, we're going to work on strategies for implants. Now, if you have this beautiful implant site, you can only mess it up. Then you place the implant that is non-restorable, and I'll tell you when to go to my screen, okay? And that can create a huge problem. So we're going to do some CGI. I don't know, what's your experience with CGI?
You know, CGI is an amazing thing that really gives predictability, and it's really easy to be off just by a little bit and have the final implant be like, oh man, I wish it was a little bit too, a little bit more distal or a little bit more mesial. It's, it's very challenging to drill into a 3D area and know exactly where to place it. And after I did CGI once you go CGI, you never go back.
Okay, so here it is, Michael. Go to my screen.
Or at least whenever you can do it, you would do it.
Yeah, I mean, I do it in every case. Not every case requires CGI, but it's ideal because it allows you to place an implant in the best position and the safest position. But you see, that's the beauty about 3D. And this is a case, patient was referred to me. What do you think about the angulation?
The angulation, it seems fairly parallel to the molar.
Looks good.
Looks good.
Looks wonderful, right? Mesodistal angulation. We want the angulation to be parallel with the contact area. But let me show you a clinical photo. So this is the implant.
Oh, that's very nice.
It looks different. Okay? Now, we're all entitled to make mistakes.
Yes.
But the mistake here is in the buccal-lingual direction, dimension. Let's call it, it's a little bit too buccal.
Yeah,
Okay, only a little bit?
just a little bit.
Just a little bit? Okay. These things do happen. Okay, we all have made mistakes. But if you malposition an implant, don't leave your implant there. You'll see. You malposition it, you can't correct it.
The difficult,
That's why God invented reverse.
the difficult thing is breaking it to the patient.
Well, that's a whole different story.
And sometimes we go back to that thing, abort,
Abort mission.
abort.
Abort mission. Hold on. A difficult conversation with the patient. This is a difficult conversation with the patient.
Yes.
That's a much more difficult conversation that now you need to remove an implant that is integrated, is non-restorable, the patient paid a bunch of money. And Rashad, look at the soft tissue,
It's all mucosa.
all mucosa.
All mucosa.
We had some questions. I think we have some questions about mucosa. What's your experience? And you did a bunch of implants in the past year. What's your experience with, let's move on the next level, with soft tissue. What is in your, kind of your experience, the things that you struggled with when it comes to soft tissue?
Establishing more attached gingiva, and just realizing that that's something that is crucial for the long-term success of my implants. And the next level for me was like, okay, I need to have more attached gingiva. Now, what type of surgery do I need to do to achieve that? And the knowledge is you know, not everyone focuses on gingiva. So over the past year, with your help, I've been laser focused on gingiva. I've been laser focused on establishing a proper implant site. And I've been having really good results. Thank God, it's been amazing. And I did a case recently with 3 implants. I did it guided. The patient didn't have enough attached gingiva. I did a connective tissue graft from the palate, and I had a great result. And you helped me with that case. You mentored me, and I watched the videos, and it was awesome.
Yeah.
Yeah.
You know, and that's amazing. We're going to go over this case because I think that's a case that can teach, not just teach, it can inspire a lot of dentists out there to do the same, because we don't have to live with poor tissue quality. We don't have to live with poor bone. These are things that we can all learn. And I'm never implying that this is an easy road. We have to put the time, we have to put the effort, and you can learn from other doctors that had the same experience and made all the mistakes and learn from what they are. And I made a lot of mistakes in terms of soft tissue, because in the 80s and 90s, when implants just started, the idea was, let's get good bone, let's get those implants to integrate. It was a miracle, and it was, you know, a revolution in dentistry, in the world, actually. But as we understood implants more, what happened is that a lot of those implants failed because they were in poor tissue. And poor tissue, in my opinion, is one of the main reasons for implant failures. And a lot of doctors are negligent. So one thing we talked about already is the flap design and incision outlines. But actually, taking a site that is very deficient almost looks impossible, and getting it to be hefty and beefy in terms of soft tissue is something that has a blueprint. And I think you watched the blueprint. Maybe we should go to
Sure.
maybe go to your case. Tell
And
us a little bit about this.
And it feels so good when when you start with mucosa everywhere, and then you learn these steps on how to do it, and it works like magic. It's a blueprint that works, and I think dentists should look at it, should use it. And what's awesome is I'm developing a name in my community as a general dentist, as someone who knows how to deal with soft tissue. And I get referrals from other dentists to do it because I seem to have an awareness of it that I've understood from studying with Ziv, that it seems that other schools of thought don't put as much focus on it. So this is an awesome case, and it's a patient who I did 3 implants on. There was no attached, there was mucosa up to the middle of the ridge, and you'll see the picture right now.
Okay, we can go to the screen now.
So out on the left, you see where, there's 3 implants in there, and they're very well integrated. You can go.
There you go. Okay, good.
So out on the left, mucosa, should I just uncover and do stage 2 implant surgery and restore? I said no. I informed the patient, hey, attached gingiva is important for the long-term success of your case. I had good rapport with him. I told him it's a surgery that can hurt because I'm taking tissue from the palate. So I was able to inform the patient of all the possible mishaps or challenges ahead of time. And I'm not trying to sell anything. I just look at the case and I tell them the truth. And it's amazing. The truth works. So the guy's
Go figure.
The guy's like, okay, go ahead. You know best, doctor. Do it. So partial thickness flap, and I sutured to the periosteum. I got my graft from the palate. I took my time into fitting it exactly where I want to fit it. One thing I did a releasing on the mesial, on the distal of that premolar, and you later told me it's better to avoid that. There was some more tissue I could have covered in the distal area there, in the area, in the molar area, second molar area. But I chose not to remove more tissue from the palate because next time I wouldn't take that much thickness from the palate, but he healed well. I also used peri-acryl to cover the palate, and the patient came back and he said, you know what? I had no pain. I told him some people are crazy, they don't have any pain, some people have a lot of pain. So he came back to me, he's like, I must be crazy, doctor. So a great guy, bless him. And that's what you see right there. I had an awesome result, and it felt so good to be doing implant dentistry at that level. It gave me confidence in my abilities. It really, I felt great. I felt like I'm offering these people an excellent service. It also gave me an opportunity to make more income, to generate more income doing something that benefits the patient, and in the process everyone was happy. And I know my implants are going to be in there for a long time with awesome resilient tissue around them. So that's my story with that. And
that's a good story.
Yeah.
That's a good story. I mean, if you look at the results, and I just blew it up a little bit because the accomplishment here is incredible. I could not have done this better, because if you're looking at the top picture, there is a very thin layer of keratinized tissue, probably between 1 and 2 millimeters, maybe pushing 3, closer to the mesial. Now you take a look at the lower picture, you're looking at, what is that, 8, 9, maybe 10. It gets a little bit thinner in the back, actually where you did your vertical, but that's a great result. So what happened to those old implants when they are surrounded by mucosa? And some of you may think, what's the big deal? They're well in bone, they're surrounded with soft tissue. What's the big deal having mucosa? Well, it is a big deal because mucosa stretches and mucosa recedes. And mucosa acts as a trap every time the cheek moves or the muscles are pulling, if there's a frenum or even just a very, let's call it a normal mucosal pull, the sulcus or the peri-implant tissue is going to open up, bacteria will go in, and you're getting bone loss. Why? Not because the bone is bad, just because the tissue is poor. So what you did here was an amazing service to your patient. Now, in terms of building up the skill to do that, and by the way, we're going to have this this hands-on exercise in the implant accelerator. Day number 1, part of the implant blueprint is going to be how to create good tissue quality by doing a very simple transplantation technique, using a technique that was around before you were born, before I was born, 1962. So doing a free gingival graft in the posterior mandible many times is just a savior. And this is not a free procedure. It's not something that you just give away. This is a procedure that you charge for, that you, where you provide tremendous value to your patient and tremendous value for the future, improving the prognosis of your implants. So this is fantastic. I wanted to show kind of pushing the limits of this type of procedure. Some of you guys have seen this on Facebook. Sometimes, and it's nobody's fault, sometimes because of repeated surgeries and repeated implant failures, the mucosa can creep all the way to the top of the ridge, okay? So really the only thing that can work in these types of situations is using the patient's own tissue, okay? And a small graft works the same as a big graft from a healing point of view. So what we're looking at here is the exact same thing that you did. It's a split thickness flap. It's stabilized apically with gut sutures, and then a free gingival graft from the palate and kind of put in reverse, just covering all this defect.
Wow.
Okay, so it's a little bit of a bigger graft, and that graft did hurt, but it was able to correct the defect. This is something that we use during the healing period with a stent. I don't use the periacryl, but maybe it's something to try out. I've never tried that. But this type of technique creates a lot of soft tissue, and it's predictable. Nothing is ever 100%.
Wow.
But
It's beautiful.
it's pretty close. It's pretty close to 100%. Why does this procedure work so well? Any thoughts? Why does it? Remember, you did this procedure, and I told you, you showed me the pictures, and I told Dr. Rashad, don't underestimate this graft. This graft is going to heal, and I'm not a prophet. I cannot tell the future, but when you create your split thickness flap, when you're retracting the mucosa, what's underneath? Amazing soft tissue quality, amazing vascularity, amazing blood supply. So it's very rare for those grafts to fail. Okay, so think about it. If you can, with one procedure, improve the tissue quality, prolong the longevity of your implants, charge for an additional procedure that is valuable and is necessary, okay? We're not making something up here. That's a win-win situation for all parties involved, and that's really what I wanted to always emphasize in my teachings. Figure out what you need. Don't think about flap design and papilla sparing. That's not, these are just code words. Think about what the site needs. Your patient needed attached tissue, and you took the next logical step. You harvested soft tissue from the palate and did a transplant, and it worked beautifully. Congrats. So that's amazing.
Thanks to you, because initially when you're presenting treatment to patients, there's a mindset out there. It's hard enough, a mindset of selling. Oh, we just want them to do the case. If they do it, that's enough. So it's a fear-based type of treatment planning and fear-based type of delivery of dentistry.
Yep.
So to get that mental shift that you're presenting another procedure that's going to cost thousands of dollars, and your neighbor down the street is not doing it. He'll go and he'll put those implants in and do stage 2 on mucosa, and it might work. So to get to that, it might work at a certain level. But to get to that point to where you have the confidence and the knowledge and the mindset, it really takes mentorship from someone who's doing things at a high level.
Yeah. No,
Yeah.
I mean, you're going to learn exactly what I do. We have some questions about the course. One question was, Is it only for U.S. citizens? No, it's also for U.S. citizens. It's for doctors from all over the world that can travel here to Beverly Hills. The Implant Accelerator is open for any you have to be a dentist. You have to have a dental license. I'm not going to check. And you don't have to show me your license, but it's open for dentists from all over the world. We already have doctors from Indonesia and from France and from Canada and from this country called USA. You know, we got doctors from everywhere, even from Malibu. Okay, so we got people from all over the place. So absolutely, anywhere you're at in the world, the course is happening November 12, 10 to 12. So it's coming up. If you're in a country that where the US requires you to have a visa, get on it, okay? Because sometimes these things take a few weeks, okay, depending where you're at. So we're definitely open to any doctor.
That's awesome.
Okay.
It's a great service.
Anywhere in the world where you're at, we welcome anybody from anywhere in the world here to Beverly Hills. Another question that was asked, Ziv, and it's kind of I don't know, it's an interesting question. Ziv, I did my research. This is the most expensive course in the world. The most expensive course in the world. How do I answer that?
Well, I can suggest something. So on Saturday, I saw 3 patients, and my production for that day, doing the right thing, doing things at a very high level. You see, as a general dentist, I see failing bridges every week, where an abutment is failing or both abutments are failing. So there's so much opportunity walking through the door to, instead of do another bridge, to actually do an extraction, a bone graft, an implant. So just production from that day was $10,400.
Wow.
Seeing 9 patients, 3 of them, which is actual treatment,
Wow.
other 3 delivery.
In one day.
Compare that to when I graduated, working at Western Dental, Pacific Dental, and all these around these places, seeing 20 plus patients being rushed, being pressured to produce, doing HMO, PPO type of mill type of dentistry. This is, I don't think it's for everyone, but those dentists out there who want to do things at another level, it's actually nothing compared to what this course will do to your future, to your career, and frankly, to having access to a mentor like you, Ziv, because before I've heard of you, I've seen you, your name, but after I got to know you, you've actually helped move the needle for me, as you are doing for so many dentists out there.
The needle is moving.
Move the needle.
The needle is moving. Guys, and I want to answer this question, and thank you, because yes, this course is really on the high end of cost, and really, we also did the research, and it is the most expensive course in the world, because the value that you're getting is probably 10 times more than what you're paying over the year. This is not a type of course where you're going to spend the weekend with me, and after the course I'm going to say bye-bye and nice to meet you and good luck to you. This course is a full year mentorship and coaching program that is going to accompany you for a full year after you finish the course. So each month we're going to have mentorship and coaching opportunities to work together, whether it's live online, whether you submit your cases for my review and participate in discussions of the whole group taking this particular course. I'm going to make sure that you're going to implement all these things. What's the point in paying all this money and taking a course, spending the time, leaving your family, traveling, staying in hotels, and not implementing? So the idea behind this course is implementation. I'm going to teach you the principles, but I want to take you by the hand, and I want to take you to wherever you're practicing and help you implement these principles. And that's why we're going to have monthly coaching sessions and opportunities. So you're going to perform all of these procedures. And I believe that once you take this course, it's not going to be anything even remotely close to any course that you've taken in the past. I crafted this course with a lot of thought. I put a lot of energy just in thinking. Before we even came up with this promotion, I wanted to create something that is going to change the world for you. That you call it move the needle. Absolutely, that's moving the needle, meaning moving fast, shortening your learning curve. No point in taking a million courses. What's the point in traveling to Hungary and to Toronto and to LA and to South America and being all scattered? The idea behind this course, it's all in one place. You have myself personally teaching and mentoring you, and that's another reason the entry price is relatively high. We cannot have too many dentists. This course is limited to 24 dentists only. We already have a lot of dentists that signed up. I cannot cut myself into hundreds and thousands of pieces. I need to be dedicated for this group of doctors for the duration of the course, for the full year after that. And the onus is on you and on me together. We have to together make sure that you implement these procedures, that I make sure that all these challenges, all these complications and problems that you're currently facing, I want to make sure they're all clear. And really one of the main goals that I have now in the course is to create clarity, but clarity on steroids. I'm going to, and I already did because the course is ready. I took away all the fluff, all the things that are not important. I trimmed, we call it trim the fat here in the United States. We like to stay fit. So we trimmed the fat. We stayed with the core knowledge, core information that is going to create a lot of clarity in your mind. The number one problem a lot of doctors are having now, and always had, and I was confused myself, is the lack of clarity, confusion, over-analyzing, getting too much information, a whole lot more than you need. And you get paralysis because of over-analysis. Okay, you over-analyze what you need to do. You have bits and pieces of information. You don't have clarity. You're not sure about what you need to do. In this course, my intention is to change all of that for you. And I stand behind it 100%. I offer, and it kind of shocked the dental industry and a lot of the other teaching institutes out there, our friendly competitors. The guarantee that I offered for this course is unheard of. And when you come to this course and you learn for those 3.5 days, you get the knowledge, you get mentored and coached by me personally. You become part of the Surgical Master Academy. You get all the lecture material, all the resources, all the very much hand in hand, over the shoulder instructions, step by step. And if for whatever reason this did not work out for you, then your money back guaranteed at the end of this course. So come attend the course, take all the knowledge. Okay? I cannot go into your brain and take it out again. Take all the knowledge, get all the resources. If it didn't work out for you, your money back guaranteed at the end of the course. And I wanted to take it one step farther. If for whatever reason, you're not just, we call it satisfaction guarantee. Okay, we heard this before, 100% satisfaction guarantee. I don't like the word satisfaction. I don't know what you feel about that. I don't like satisfied. Satisfied is like, it's okay. I want you to be blown away. I want you to be blown away by the information that you're getting, by the clarity, by the shortening of the learning curve, moving fast. I like the moving the needle. Okay, we got to be careful when we go too fast, but we want to go fast. We don't have time. So if for whatever reason you were not blown away by this course, then your money back guarantee but I will also pay for your flight, coming to the course and going back home.
So you get to come to Beverly Hills and go, and you can pay for it?
I cannot take out the food out of your stomach. I cannot do that. Okay, so the reason I did that, and it's extreme, and you told me don't do it, but I decided that we need to do that because we stand behind that. And if you're not blown away, I did not do my job.
Yep.
I did not do my job. The onus is on me as an educator to give you the best experience ever. So come to Beverly Hills, take the course, Implant Accelerator, starting November 10th to the 12th. And let's answer some more questions.
Yeah.
Let's do some more questions here.
So I have some questions.
Okay.
What exact material do you use, from Dr. David, for vertical ridge augmentation? If you use a non-resorbable membrane, when do you remove it?
Okay, there are two questions here. Vertical augmentation, we're dealing with a very significant challenge. Vertical augmentation is not a predictable procedure in everybody's hands. Let's put it out there right now. It's not horizontal augmentation. Horizontal augmentation is very predictable to some extent. I can't say 100%. Vertical augmentation, there are so many different factors, and not every vertical defect is the same. So let's start with that. The key for vertical augmentation, okay, if you want to just remember the principles, remember we're talking about blueprints. We're talking about not being robots, just being able to develop critical thinking. The key for vertical augmentation is space maintenance. Similar to what we have in the sinus before, we talked about that. You need to preserve a space for the bone to grow. And that cannot be achieved with a resorbable membrane. That's the reality. That's the limitation of a resorbable membrane. You may want to use resorbable membrane to drape around your graft, but the two main methodologies for vertical augmentation are tenting screws, where you're placing screws that are meant to tent a titanium reinforced membrane, or a titanium mesh, because it's a rigid structure that will not collapse on itself, as opposed to a collagen membrane. Think about that. So common sense. And if you want to give it a try and try to create vertical augmentation just by using a bunch of collagen membranes, you're in for a disappointment. And we don't like disappointment, but we all need to go through some pain maybe. So on your path, and that's really a key message, and I'm going to answer the question specifically. On your path to be able to do vertical augmentation, don't go there yet. Stay at horizontal augmentation for a couple of years, for a year or two. There's a lot to do with flap management, with incisions, with releasing flaps, with getting a nice clean recipient site, with creating bleeding points, managing tissue, managing complications of horizontal augmentation first. Hey, you went there, you've done that, you're ready to the next step, I take you by the hand, let's do it. But don't jump there first, because what's going to happen, you get disappointed. Because if you think that augmentation is like Legos, just stack the pieces one on top of the other and bone will form, the answer is no. It doesn't work this way. Vertical augmentation has its own limitation. 4 or 5 millimeters max. 4 or 5 millimeters. So what if you have zero bone? You may need to do multiple procedures or use a short implant. Okay, so vertical augmentation currently is one of the most challenging defects to graft, combination horizontal and vertical. And I'm not saying it's not possible, but be very, very careful. Okay, we talk about cases almost every day. Be extremely careful when you're looking at a case where vertical augmentation was done and everything turned out great and you have a huge mountain of bone that grew. I'm not saying it doesn't work, but how often does it work really? How often does the speaker, lecturer, whoever presents the case, do those. Do they have 20 cases like that? 10, 5, 2? Usually the answer is no, okay? So we have to be careful in what we teach. And recently we sent out a series of emails that were like basically like a synopsis of my philosophy on bone grafting. And I talked about that, about how we need to be careful when we go to a lecture, how we need to be always critical, not doubting the speaker. The speakers are really at the top of the game most of the time. And they're very knowledgeable and specialized and are experts. But we have to have critical thinking in the sense, does it always work? Or does it work every once in a while? So be very critical, okay? So I'm going to be very open in the course, in the accelerator. I'm going to tell you, these are things that you can use day in, day out. Why? Because I use them. Take it to the bank, meaning it's worth using it. And when there is a risky situation, I'm also going to tell you, you know what? Proceed with caution. Because, hey, every failure takes you back. Takes you back financially, takes you back from a reputation point of view, and also takes you back mentally, which is the worst. That's the worst. And you and other doctors and myself included experienced the lack of confidence. When you lose your confidence, you're not sure what to do.
This is golden advice, Ziv. You know, I'd go to lectures in the past and I'd see amazing work on screen. I'd be like, man, how can I ever get to this point? And what you just said is a reality that's not really shared that much. These guys are showing their best things out there. And a lot of times, I also had an experience where whoever's lecturing, I didn't feel they were really supportive. Some were judgmental also. So I became very selective about who I, follow, who I learn from, because some people might seem like they're teaching, but in essence, they might be putting your confidence down because they're not sharing the whole truth.
Yeah, I mean, and I mentioned this in an email. I'm not on a vendetta against the speaking world. Okay, that's not the purpose here. The purpose here is the truth. And the truth is the most important thing in life, because what else do you have except for the truth? It is more powerful.
It sets you free.
Yeah, we need to know the truth. So what we need to know is what's predictable, what works most of the time, what has some doubtful predictability, what doesn't work. And you deserve to know that. And here's another trick to success. Case selection. Pick successful cases. Don't pick loser cases. Now, how do you know what's a loser case? That's what you need to learn.
That's why I have a mentor.
We gotta be mentored. Okay. There was a question, Mike. If you want to go to the screen, do you need to have a CT scanner or do CGI to attend the accelerator program? Well, I don't have a CT scanner. I don't own one. Dr. Rashad has one in his office. I use his sometimes. I refer to another doctor. I refer to a radiologist for a scan. Having a CT scanner in your practice is not a requirement. It's not a prerequisite that you need to have to do implants at the high level, not even at CGI. And you don't have to do CGI. Okay, I'm going to show you how to do this in a simplified way, in a clear way, without the confusion. But you don't have to own the software. You don't have to own the technology. You don't have to own very expensive equipment. You need to invest in good materials and good instruments. You need to invest in your education. The investment in yourself is always the one that is the most important, but it's not a pre-requirement. Okay, so I want just to put it out there. Okay, if some doctors are thinking, I'm not ready for that. I'm not ready to do socket shielding and use PRF. Well, you don't have to be successful. And I hope this broadcast is helpful to you, the doctor that is starting out, the one that is intermediate, even advanced dentists and surgeons out there. Our goal here is to educate. But if you are thinking seriously about education, that's where you want to put your emphasis. This is where you want to learn as best as you can. And I position myself as a doctor that is not just teaching and throwing cases on a PowerPoint slide and here's do the 1, 2, 3s. I really want you to have clarity, and I want you to know and understand not just how I did it, but why I did it. Number 3, I want you to do the same and have the same success. So that's really important. And there's a question here: how does the mentoring work? How do you mentor a doctor? I mean, you're a busy guy. You got a big family. You got a busy practice, teaching, creating videos. Well, the mentoring works in a way that is organized through the online platforms. So we have dedicated times during the month where we are going to learn together and practice, and we're going to go over cases, and we're going to learn as a group. So that enhances the learning experience. So the online world opened tremendous opportunities for us. Okay?
And I can vouch for that, Ziv. I can vouch for how mentoring and guidance, and not only that, being around someone who is positive, uplifting, supportive, really does something to your psyche to elevate you, to get you to a point to where you can believe in yourself again and do the things that you're meant to do the things that you want to do. And the trickle effect goes far beyond just dentistry.
Yep. No, we kind of brought it to, let's see, let me see. Yeah.
We need a card on that one camera.
Yeah.
I'm going to step and
that's okay. You want to do, and I can talk about what I think is important. Maybe is there another question here? I saw a question on my phone. Okay. A patient is actually asking me, is it okay to play soccer after surgery? And I guess it's okay. Okay.
We have
Don't be goalie.
We have Dr. Hever on the line. Our regards to you, Dr. Hever. I love you. We love you.
Hi, Dr. Hever. Dr. Hever introduced me to my wife and introduced me to Dr. Ryman. Go figure. Okay. So, a lot of doctors asking me, what does it take to be at the top of your game? What does it take to be clear and understanding of how implant surgeries work and what's behind it? So definitely clarity, understanding what you need to do and understanding the principles and understanding strategies of what the top surgeons are doing. And this is really interesting because and this has nothing to do with dentistry right now. If you want to be successful in any field, you want to be a great, I don't know what, a real estate agent, you want to be a great banker, a great businessman, or a great surgeon, the best thing that you can do, your best bet, is to find who are the successful surgeons, who are the best surgeons in the world that are successful, not just in teaching, but actually made it in private practice. Okay, this is one of the things that are so interesting, that a lot of the speakers are great speakers and great clinicians and great mentors, but they don't have the knowledge from private practice that is so important. Okay, so if you want to be successful, if you want to be a successful private practice surgeon, clinician, dentist, find the top surgeons, who the top surgeons are, and do as they do. Replicate what they're doing. Follow their philosophies, their treatment plans, their strategies. That's extremely important. Now, doing it by yourself is kind of hard. It's kind of hard because we sometimes live in a bubble. We are in our own practice. We go from home to our practice, back and forth. Maybe we stop at the gym every once in a while, socialize every once in a while, but life's busy. There's a lot of things that we want to accomplish, and a lot of things that it takes a lot of energy and a lot of effort to be successful. And sometimes we feel kind of alone. We feel, it's kind of scary. So you need the support. You need the mentorship. So the first thing I would advise you, find doctors in your community or even in the online community that are on the same path like you and be friends with them. Okay, community is everything. And this is what I try to do with Surgical Master. We now have close to 20,000 dentists in our network. Okay, we're definitely not alone. We're just a big group now. Okay, and a good group, and a lot of doctors that are non-judgmental, geared towards excellence, geared towards success, and want to learn and improve. So you want to be supported by your peers, and you want to be mentored, because you need, like a GPS, you need something that would guide you on the right way. And if you're making mistakes, you want to know what those are. You want to know how to correct them. If you're doing things great, you need some praise. You need some pats on the back, and you need to be able to know that you're on the right track. That's the only way to learn and create your confidence. Confidence is not something that just comes out of nowhere. We're not born confident, okay? I can tell you this for a fact, raising 4 babies. Okay, they're not confident. They scream and they cry, and the slightest thing scares them, and they're hungry. They're throwing a tantrum. Okay, they're not confident that their parent is going to feed them. Okay, so we're not born confident. But how do we learn confidence? We learn it from the surrounding. Okay, it's definitely something that can be learned. We learn it by gaining more knowledge, gaining support. We're gaining confidence by encouragement. So it's almost like going to the gym. Okay, confidence is like a muscle, no doubt about it. If you feel that you're not confident about surgery or about anything in life, or clinical stuff, practice management stuff, find somebody confident, somebody who can support and mentor you, and create your own confidence. It may not be, a couple of days. It may take a couple of weeks. It may take a couple of months. It may take a couple of years to be fully confident, but definitely something that can be learned. And we now know that from research that mindsets can be changed. And a winning mindset can be learned. So I don't want you to be kind of holding back because you don't feel confident and this is too much for you. So if you want this clarity and you want to learn what the top surgeons in the world do, and you want to get supported, and you want to get mentored and gain the clarity and gain the confidence, I believe that the Implant Accelerator is a great program for you. And this is happening live in Beverly Hills, California. It's a full year coaching and mentorship program here in Beverly Hills Lab on Wilshire Boulevard. We have a gym downstairs where we're going to be working out every day before the course. I'm a very strong believer that if you want to do something really well, you want to be successful, you need to be in shape. You don't need to be an Olympic athlete. You don't have to compete. Okay, and by the way, if you have any reason not to work out, or you're not able to run because you just had a knee surgery, we have one doctor that has a knee surgery, it's not a prerequisite, okay? Okay, I'm not an athlete myself. I just like to stay in shape. But I believe that if we take this 3-day course and we maximize our time together, I'd like to show you what makes one successful. And part of it is being physically active. Because when you do surgeries, and I don't know about you, Rashad, but if you do surgeries and if you're not in shape, my back hurts. I'm going to have like neck pain. I'm going to be miserable on the floor with Advil and muscle relaxants. But if you work your core, if you are in shape It really helps with those rigorous surgeries, and it also helps with your mindset. You have more energy. Okay, so the course in Beverly Hills is live, hands-on coaching, mentoring. I'm going to spend a lot of time with you. You're going to learn the tactics. I'm going to teach you how to create a great implant site. We can go to the slide. The implant accelerator is meant to do all of that. Okay, it's meant to teach you the tactics and strategies to create an ideal implant site for perfect placement, teach you specialized skills. So important. I created my practice based on specialized skills. That's what the top surgeons in the world are doing. They are practicing, doing things that other people are not doing. Okay, so if you want to learn the best practices and strategies and what is working today and build knowledge and confidence and build your own top implant practice under my personal coaching and mentoring, nobody else. That's why we can take only 24 doctors and no need to travel the world all in one place. If you want all of that, the Implant Accelerator program is for you. So Rashad, when we created this program, by definition, we wanted to divide it into 3 days, okay? And naturally, and that was actually one of the questions, how can I become a top implant surgeon in 3 days? You can't. You can't. Of course, otherwise everybody would do that, okay? And we would have, so many doctors doing that. But what it does, it creates clarity and it creates a certain mindset.
You can gain the mindset and the strategy and know what to focus on so you don't waste your time and face problems that will set you back years, and have access to an awesome mentor.
And that's what we're doing in intensive 3 days here in Beverly Hills. So the 3 days live, of course, taking benefit of all the beautiful sites in Beverly Hills and beautiful restaurants. And for sure, we're going to wine and dine you well. But this is going to be intensive because when you join the course, it is a live hands-on course that happens here in November here in Beverly Hills. But when you sign up, we are starting our pre-course activity, which is basically touching base with you and finding out what are your challenges, what are the problems that you're having that are holding you back. Is it confidence? Is it clinical skills? Is it mindset? Is it soft tissue problems? Is it more the angulation? What are your particular challenges? And these very topics, these exact topics, are going to be incorporated in the course.
It's customized.
It's a custom course. It's a custom course. It's unheard of. It's not a cookie cutter course. And every other doctor in this course is going to benefit from each other's weaknesses. And together we're going to learn as a group. So that's just what we call synergy. Now, when the course is over, it's not done. We're looking at a full year from the moment the course starts, with monthly coaching calls and webinars, you being able to submit your cases, being able to consult with me, show me all the issues that you have, everything that is happening in your own private practice, wherever you're at. Okay, if you are living close, if you practice close by, hey, let's have lunch. But that's not the reality. Most doctors are far away. So this is a full year mentorship and coaching program limited to 24 dentists. So this is basically the breakdown of the course. The first day is our implant site blueprint. I'm going to teach you the 3 most common defects. I mean, why would I teach you about defects that rarely happen, that we don't see as common? We see it once a year. I'm going to teach you the 3 most common defects that you're seeing almost every day, every week. That's what you need to know. That's 80-90% of your practice. I'm going to teach you how to handle them, how to address the missing buccal plates, how to deal with those big infections, what to deal with these sites, how to deal with the bone grafts and the membranes, how to layer all these materials, and really show you the blueprint. And when I say blueprint, I'm definitely not going to be dogmatic. Dogma is not allowed in our course. Okay, if I ever say something dogmatic, Rashad, you just, throw something at me, hit me.
I'll throw an implant.
throw an implant, I don't know, darts, whatever. Dogma is not allowed. Ego is not allowed. It's going to be all business. And it's going to be about, okay, it may deter some doctors. It'd be about 10 hours a day. From morning, if you want to, come out and work out with me. We'll go for a little run in Beverly Hills. We may go for a walk. I don't know. We may lift weights. I don't know. Depends how who you are. But it's an opportunity to talk, and it's an opportunity to work on mindset, and also to plan the day. So when we finish our physical activity, we're going to obviously have breakfast, and we're going to plan our day. And the first day is dedicated to implant site development. Part of it being how to enhance your results with PRF. We're going to have the best phlebotomist in Beverly Hills. She's going to come and teach you how to draw blood, what are the tips and tricks. It's not a phlebotomy course. It doesn't certify you in phlebotomy, but you're going to see how this is being done, how the materials are being processed, how your assistant can create what I call the mix, what type of bone graft, how we place our metronidazole, how we mix it with PRF, what surgical tools and instruments are used. And I'm going to talk about dentin grafting, how to use dentin grafts for augmentation, okay? How to deal with soft tissue quality, things like that. We're going to have a hands-on exercise on grafting an implant site. The same case I just showed you, I'm going to teach you exactly how to do that. And really, there are so many other perks for learning this type of graft. If you know how to do this graft, you'll be able to perform this graft at least once or twice a week, not for implants, but for teeth. This is the mainstream free gingival graft to increase tissue quality that a lot of patients have a problem with. So guess what? You're learning something that is applicable for teeth and implants. It's a double benefit, okay? So soft tissue augmentation, how to create a great implant site, not just from a bone perspective, also from a soft tissue perspective, and really demystify the contour graft. A lot of doctors, Rashad, like what the heck is this contour graft? Is this just stuffing some bone in there for pretend, just so for our conscious? We're going to answer that, okay? And I'll tell you why it is important and how it improves our implant sites. And I'm very big on complications. So complications, I'm going to be drilling into your head every day, all the time. And I'm going to show you not other people's complications where I fix that, but my own complications and how to handle them. Not just clinically, doctors, not just clinically. It's not just about the management. A lot of you guys watching this bought the course called Complications 911. And thank you for that. And thank you for buying this course and participating and expressing that this course really helped you to manage complications. It's a mindset issue. It's an issue of patient management, not so much clinical management. Clinical management is important, extremely. But the difference between a successful surgeon and one that is not that successful is the way they manage complications. And that's very critical. Okay, so I'm big on complications. I'm going to teach you how to treat those failed bone grafts, how to retreat, and how to manage the patient. And really getting into deeper into the complication 911 philosophy, okay? And we're going to finish off with a suture exercise. I'm going to show you the relevant suturing techniques that are important for bone grafting. And we're going to use every opportunity to study. Your time is valuable. Your investment is significant. You're going to get all this value back multiple times. However, time is the most precious thing in life. It just never comes back. We can only count how many days are left. And for some of us, we have less years and less days than what we experience. Maybe myself included. Who knows? I'm getting up there. I'm getting old. So time is so valuable. So I promise that I'm not going to waste your time. I took away the fluff and it's going to be just the thing, just the actionable meat, what you need. And I'm going to utilize our meals, our time together to study. So when we are having lunch, I'm going to review cases. When we're having dinner, and the first day is going to be about my failures and what I learned from them and what I did about them. So every opportunity is about learning and getting better, okay? There's not going to be any time wasted, okay? And I know that this type of course is attracting a very specific doctor, and this is done intentionally. I'm interested in working with doctors that are success-oriented, that want to have the mindset to be successful, that want to be high performers, that want to take where they are right now and go to the next level, not just stay for 30, 40 years and just go, if you just want to visit Beverly Hills for fun, you're more than welcome. But if you want to learn principles and methods and strategies and tactics and being intentional about what you do, this course is for you. Okay, so this was day number 1. Okay, any questions about day number 1? I don't know.
We have a question. Do you discuss treatment plan presentation during the course?
Yes, absolutely. Treatment plan presentation or case acceptance issues are critical, because let's say you have all the skills and you have all the knowledge and you learned all of that and you can do all of that and you're a talented guy, you know how to do things with your hands. But when your patient sits in the chair, you forget your words and you say the wrong things. You talk maybe too fast, too confident, not too much confident. You become too cocky, boasty. You won't be able to have the patient agree to the treatment plan. So I'm going to focus on that. And again, I'm not going to just give you a cookie cutter formula. Every case is different. But the principles that I'm going to be talking about are based on psychology and influence and things that I've learned outside the dental world. In dentistry, we learn skills. We learned how to be technicians. Would you agree?
Absolutely.
We became like good technicians, like, okay, do this, do that. And same in surgery.
And I know you put in enormous amount of hours listening to and studying those type of skills outside of dentistry. And it's and what's cool is how you systemize it and you make it applicable and teachable in dentistry.
Well, I see, we can be more like holistic or organic. It's all the same thing. So if I'm trying to influence you, or if I'm trying to market an idea to you, or I'm trying to convince you about something that I'm saying, or the same with my wife or with my partner or a friend, what's the difference if I'm talking about dentistry, about something that is good for you treatment-wise, or some other decision or some treatment planning dilemma? It's all the same concepts. So
and would you
there's
say
a lot to learn.
It's a mindset?
It's a mindset.
It's
And
a mindset.
I did not always have it.
Yeah.
I did not always have it. I don't want you to doctors watching, and you know me for a long time already. I was not always like that. I was not always all that. Okay, before I had this knowledge, I was pretty much blind to what the opportunities are. And by understanding psychology, understanding very simple principles, for example, we want what we don't have. Okay, we are going to chase what's running away from us, or we value what we pay for. These are very simple principles that kind of make sense to us, but when you hear them for the first time, it resonates with you, and then you're thinking, hey, why doesn't this principle apply to dentistry? Why am I breaking my fees and charging so little for an implant, for a procedure? Why? Because I'm not believing in myself. I don't have enough confidence in myself.
And getting burnt out in the process.
You're getting burnt out. You're not getting compensated but it's actually the opposite. The opposite is that your patients, once they know what you have to offer, will value you as a person, as a surgeon, as a doctor, and they will gladly pay the higher fees if they have confidence in you. And that's really what patients are looking for. So I'm pretty strong on mindset, and that's part of the course, absolutely. And that kind of goes into case acceptance as well.
You know, Ziv, I noticed a lot of times when in dentistry, I've seen it. Dentists who seem to be successful in certain things use certain tools and focus on certain treatments and position themselves in the market in certain ways. They don't always have the best skills, but they know what to focus on and what to do. And if someone is going into surgery, and I've had tangible results in my life and career as a dentist following and doing and being mentored from what you present and how you do it. I mean, heck, you see some of Hollywood's biggest A-listers, and they come to you for a reason. Hundreds of dentists refer to you and trust you for a reason. So for me, it was a no-brainer to learn from someone like you, because it actually impacted my life on a personal level and on a career level. And yeah, and I think that's a key element to what this course offers those who can see it.
Yeah, I mean, this course is not for everybody.
No.
Let's face it, it's not for everybody, and not everybody can get in because we're limited in attendance. But it's, you know, it's for doctors really like us. And I really feel that likes attract.
Likes attract.
Birds of a feather flock together. Okay, birds of a feather flock together. Likes. And I feel that in the surgical master community, we attracted a lot of us. So when I talk to doctors from all over the world, I kind of see myself or Rashad in just speaking Greek or Turkish or Arabic or whatever the language may be. We attracted doctors with a mindset that wants to learn and wants to be successful and also keeps their ego in check. Ego is the enemy. Okay, I'm going to talk about that in the course. Your ego is going to bring you down. We all have egos. We got to keep them in check. So this course is for doctors that want to be better. Okay, now, is the course guaranteed? Yes, it's guaranteed that this course is going to be the best course you've taken before. It's a strong statement. It's a strong guarantee. And if you didn't feel the same way, then you get your money back. Okay, I'm going to talk a little bit more about day 2, and then we should answer some questions, because we have, I don't know if we can answer. We have like almost 70 questions between all the platforms. But I think that's important to kind of balance things out and give you some advice. Okay, thank you so much for attending, and for the doctors that are joining us right now, because some places in the world you're just waking up and you're seeing that Ziv Simon is live. I am live for the past, I guess, 2.5 hours. We're already talking, and it feels like 5 minutes, because why? We're enjoying that, and that's really fun to share. Thanks to all the kind of the surgical master team here all around us, giving us the questions and helping us out with the technical stuff. We are simple doctors and surgeons, okay? We don't pretend to know all the technical stuff, so we took Michael here, professional Jonathan right here in the back. So thanks, guys. Okay, so day number 2. Day number 1 was the implant site blueprint. 2 is our implant surgery tactics. So in this day, you're going to learn how to assess any reach for implants in 4 simple steps. Okay, you're going to learn how to assess the site, how to create your virtual wax up or actual wax up, how to analyze the CT scan and implement it in the surgery. And a big focus on the second day is how to plan your implants. So a lot of doctors are afraid of technology. They're afraid of the digital stuff and computers and using a mouse, fear is going to hold you back. So fear is totally normal. We all have fears. Every day, every week, yours truly included. I have fears. You have fears, okay? I was a little bit nervous before this broadcast. Hey, I call it a fear, okay? The key is not the fear. The key is understanding, facing it, looking at the face, and welcoming it, and overcoming it. I know it sounds cliche, but it's so true, because if you just let your fears bring you down, you're not going to make the progress. And a lot of doctors are fearing the digital aspect of dentistry. Dentistry medicine is going digital. It's going computerized. Join the bandwagon. Join us in the, we coined the term CGI. You termed the coin. You coined the term CGI, and we call it CGI tribe. We became a tribe. You want to join?
I'm in.
You're a leader.
I'm in. You know, sometimes to overcome fears, Eve, you need an angel. You need an angel that comes to you in some shape or form, because there are sharks out there. There is a mentality of lack in this world that does exist. And sometimes you need someone who has done it, been there, and has the open heart and the wealth inside them to share, to help, to give someone who's on their path support to get there.
Yeah. Thank you. I mean, that's, you see, the confidence, like I said before, you're not born with it, but you can be taught. You can be taught to be confident. You can overcome fears. Simple thing to do. Here's a word of advice. Read books. Listen to books. Read book summaries. Okay, I'm going to, if you want, I can teach you how I read books, and you don't have to spend years. I go through 40, 50 books a year. There's so much knowledge in there that is shared for just a ridiculous amount.
$14.
$14 free information. So one way to become more courageous, more confident, is to read about bravery, about courageous people, about, read autobiographies, okay? Autobiographies of courageous people that changed the world. It rubs off you. This courage is going to stick on you, okay? We're getting a little bit distracted here. We're just having fun here.
It's a fun topic,
It's a fun topic, and I'm going to talk about that. Maybe while I run, okay? Now, I have to get in shape, because here's another trick. If you're running with a partner, and if you want to know if you're in shape or not, what does it have to do with dentistry? I don't know. We'll find out. If you guys can carry a conversation while you run, a full conversation, no problem, non-stop, you're not in shape. Okay? You're not in shape. You got to run a little bit faster, okay? So you got to take some breaks. Okay, so CGI. CGI, we're going to demystify. We're going to break down the fear. We'll have a CGI hands-on with computers. I'm going to be there teaching you. Part of this course, when you join, I'll talk about it in a few minutes. You're getting the, I'm not sure where it is. It's right here. The CGI box. Okay, that's one of the programs that you'll be getting when you join the implant accelerator. And really what's important with implants, and that goes back to some of the questions that we had during this broadcast, is strategies for implant placement. Now, strategy sounds like a huge word. I don't know, when I think about strategy, it's like, okay, are we going to war? Is it like, do we need to conquer, a continent? What's the strategy here? But it is. It really is. It's really war. We really have to win this game. And implants are not just drilling a hole in bone and filling it with titanium. I mean, we now know. And this is why, unfortunately, a lot of you doctors, what you're taught, and that's okay. Don't feel bad if this is how you were taught, because I was taught the same way initially. And this is kind of the first step. Just learn how to use the different tools. Learn how to drill, learn the drilling protocol, how to create an osteotomy, learn about bone physiology, learn about osseointegration. That's really important. No doubt about it. But you need strategies. You need to understand where to place your implants, in what angulation, and why. How to position them, how to spread them, how many implants, number of implants, how to focus on safety throughout the whole process. Okay, so yeah, strategy. Okay, I look at myself as, you know, I want to say soldier. I hate war, but let's call it an athlete, a professional athlete. That's what I wanted. That's kind of what comes to mind right now. What does a professional athlete do? You're a professional dentist. I'm a professional dentist. What does a professional athlete do? What do they do from the morning they get up in the morning until they go to sleep?
Train.
Train. More than that, how to win the Olympics. That's their mindset. Okay, so I'm going to eat this, I'm not going to eat that, I'm going to go to the gym, I'm going to do my practice, I'm going to do some mindset, I'm going to work with a sports psychologist, and you know, I'm going to get to the Olympics. That's my mindset. Why are we different in dentistry? Let's be the same. Let's do the same. Now, if you don't like dentistry, then don't do it. Don't do it. And you're probably not watching it anyhow. You're not watching the broadcast if you don't like dentistry. You're doing something else. And that's okay too. I want to make something very, very clear. This is not for everybody. This is not for everybody. You have to love your profession. You have to enjoy it. And if you're not enjoying it right now, change it around. I believe this program is going to do that. And getting into surgery is going to do that. But it really comes from the love of the profession. So if you're a dentist and you love dentistry and you enjoy surgeries, or you would like to place implants, you'd like to do bone grafts at the high top level, like the top surgeons in the world are doing it, that's great for you. And my mindset is, how can we be better? How can I be better personally? I just don't put this on you. I apply this for myself. He's my witness, okay? I practice what I preach, okay? I practice what I preach, okay? And
Superhuman.
and I don't want you to be superhuman. I want you to be happy with your profession. And if you want to learn surgery, and you want to learn mindset, and you want to be successful, think like an athlete. Same mindset. And that's my job. That's my responsibility. If you're coming to the course and you're lost, all over the place, you're not understanding, it's not clear, you're bored, you're checking your phone and you're on the internet, you know, that's not your problem. That's my problem as a teacher. I was not able to engage you, and that's why I give you this unheard of guarantee. And I challenge any institute in dentistry, any educator teaching course here online, I say it openly. Have you ever given a guarantee like that? I think the answer is no. Okay? And why? Because I believe in this course. Okay? So we're going to talk about how to plan incision outlines and design your flaps. Talk about flaps versus flapless. How to implement implant surgery in your practice. How to turn your practice into a top implant practice. We're going to have a live surgery. Okay? I'm going to perform the surgery. We're going to broadcast. Michael, you're going to be broadcasting this surgery live into the Surgical Master Academy, okay? So pressure is on you, not on me. I want to perform, okay? I better perform, right? So, but we're going to see a live surgery, and it's not going to be something like, whoa, out of this world, I'm pushing the envelope. This is like you're going to see a surgery that you can replicate in your practice. The last thing that I want is for you to come to the course, be overwhelmed, confused. You come to your practice and you go back into your shell and you're not comfortable doing anything. That's the last thing. That would be a failure. That would be a failure. So I'm going to show you things that you see every day, but I'm going to focus on things that you didn't focus before, about the mindset, how I prepare for the surgery. What do I do in terms of my protocol, the step-by-step? What does my assistant do? What are the different steps that are critical? What is the timeout protocol that I use? A lot of doctors are emailing me, what's timeout? What's timeout? Okay, I'm going to teach you. Okay, a lot of things. And second day is really going to be about the aesthetic zone. This is like, I think, one of our biggest challenges. The aesthetic zone, how to make the implants not just integrate, but also look good. And when do we use immediate? When do we delay our placement? How do we focus on safety? And really all the challenges in the aesthetic zone, okay? While all of this time, you're constantly in touch with me, okay? It's a small course, 24 people is not a whole lot of people, okay? If we get to 24, that's great. If we get less, I'm okay with that too. It doesn't matter. The course is happening November 10th to the 12th, 2017, okay? It's coming up in a couple of weeks. You can sign up for that. Time is valuable. I'm not going to waste your time, okay? Third day, okay? Last day is all dedicated to specialized procedures, what we call our magic bullets, okay? You can do pretty well by building great implant sites and placing your implants, and most doctors are stuck there, and that's totally fine. I'm going to teach you some specific skills that the top surgeons in the world are using. And Rashad, you're now using some of them as well. And I actually, a couple of weeks ago, I had to hold you back because you wanted to do the pedicle palatal flap.
Yes.
And I told you, Rashad, you know what? That's not the case for it.
Yes.
Okay.
Thank you
You're welcome.
for that.
You're
really.
welcome. I saved you a lot of headache, and maybe we can go over the case later.
Yeah.
But I believe that if you have those specialized skills, think about it. You have an increased personal value level. You can offer more than your competition. And that's what we talked about in our series of emails to the whole community. The key to success is to increase your value, your own value. Why does a cleaning person or a waiter not make a good living? And I was a waiter too, so I know. Because everybody can do that. Everybody can serve and can clear the table.
And it applies in dentistry. You get young dentists graduating, having the basic skills of fillings and crowns and all that. They go to the marketplace in LA, in the LA market, they get paid anywhere between about an average of $500. And that doesn't cut it between family and loans and taxes and all that. So they need to up their skills, and I was there. I was at this stage, and then I started upping my skills, and I was very determined to do it. Mm-hmm. And now it's a whole different ball game. You triple, you triple, quadruple your income when you do that, and you do pass through some rough times, but when you have a mentor, that shortens those rough times, and it minimizes unnecessary headaches and rough times. And for some period of time, I didn't have a mentor, so I was banging into walls and lost and depressed and miserable and hating dentistry, and I know there's a lot of dentists out there who have experienced that or are experiencing that, and it doesn't have to be that way.
So here it is. Here's the answer. You were missing specialized skills. Your surgical skills were non-existent. Once you introduced surgical skills, grafting, better flap management, CGI, doing things at the high level, all of a sudden, hey, you're producing more than the oral surgeon in the practice you're at.
Yeah.
Why? Because you have a higher value level. And how did you learn that? By getting specialized skills. And that's the focus of the third day. And I believe that you need to be good at dental implants. You can be good at dental implants if you're good at grafting. Okay, so learning how to tunnel, to create tunnels on the tissue, is going to help you with soft tissue grafting, but also with implants. How to enhance your implant emergence profile. One of our magic bullets. Here's what you wanted to do: the palatal pedicle flap. Okay, it's a little bit tricky. Okay, we're going to show you the blueprint how to do that. We'll have a hands-on how we do that. And even more important, I'm going to show you or teach you when to use it. Don't be like a cookie cutter or everything, when you hammer, everything is a nail. Start doing that. No, we don't want that. But the rotated palatal flap or the pedicle flap is such an amazing skill to know. And you know, when I incorporate it in my practice, hey, I get another magical skill. I get another magic bullet that my competition is not doing. Okay? Same with soft tissue grafting, harvesting a connective tissue graft. First day is more free gingival. The third day we'll talk about connective tissue grafting. We'll have a hands-on focus on mindset and performance and building your confidence so you too can be the same. Now, the next topic that I'm going to teach on the third day is a very interesting magic bullet, and I want to tell you that, actually go back to the slide. This patient, I just saw her the other night at a restaurant, and she gave me a hug. So tell me what's behind this procedure, a little bit kind of a background.
So this is a depigmentation procedure, and the current methods of depigmentation on the market use lasers or chemicals or actually using a scalpel. And I was doing a depigmentation procedure some years ago with using a diode laser, and I encountered a complication because in a laser you cook the tissue. You barbecue it, and it was probably the most difficult time in my career as a dentist. I had nightmares. I was facing a very difficult complication, and I'm like, I wish I never went into dentistry. I just became like, it was horrible. It was horrible. But on the other end, my mind started thinking, man, there must be a better way to do depigmentation. There must be a better way. And it's amazing how when you ask sometimes and you're aware and you're at ease, you discover, you invent things. So I came up with a procedure for depigmentation that does not use chemicals, does not use heat, and most importantly, has a very low learning curve so that people who want to do it can do it. And then I met you because I wanted to be with one of the best periodontists in the world to develop it. And that's what the result of the Glam Gum H2 Jet technique is, which people will learn in that course.
Yeah, absolutely. And you know, that's just another proof that general dentists can be innovative and can think outside the box and can come up with techniques that a specialist never thought about. And when I met Rashad, he introduced me to this technique of depigmentation as a team. We worked on this technique together and developed it. And the doctors in this course taking the implant accelerator as part of the third day will be introduced and will be the first doctors to be certified in this new depigmentation procedure with just a very extremely simple technique. I mean, Rashad, congrats.
Thank you.
I never thought, I mean, for me, you know, sometimes we think like that. We want to scratch our ear like that. Keep things simple and safe. And that's really what this procedure is all about. So together with the surgical master team, we also had Dr. Delia Tuttle working with us on this technique back in Orange County. So Delia, if you're watching, then congrats on working with us on the depigmentation technique. Congrats on what you're doing with the gumdrop technique. The gumdrop is like taking the world.
It's on fire.
It's on pink fire. All the divas are on fire, and the girls with blades are taking over the world. So Delia is just in Bucharest, Romania. Okay,
Yes.
Delia, Cefaci, how are you? I hope you're watching this from Bucharest. Actually, it could be in the middle of the night for you there. But Delia is going to be at the course. She's one of us, okay? She has a great knowledge and skills, great personality. She's a leader among the educators right now in soft tissue grafting. She is really becoming a leader in soft tissue grafting, developing the gumdrop technique. So we are so lucky, Rashad. So lucky to have her in the course.
Absolutely.
She's going to be talking about the gumdrop technique. This is not a gumdrop course.
No.
Just to make it clear, okay? Gumdrop course is taught only by Delia. back in their practice in Orange County and around the world. But for the doctors in attendance, they will have Delia there, the inventor of the gumdrop technique, that will teach us and show us what the possibilities are and how this is an amazing magic bullet. It's an amazing surgical specialized skill that you can incorporate in your practice. Not everything is implants, guys. Implants are a great part of the practice, and it's an implant accelerator course. It's going to accelerate your learning. But a lot of the principles that you're learning are going to be applicable to other parts of your practice, your restorative practice, other procedures, crown lengthening, restorative work. And I believe, personally, I believe that this type of teaching that is very tight and close, intensive, nurturing, mentoring at the same time is going to be helpful in your life in general. I know it's a big statement, and Rashad, and I never told you that. The way I found that this has a huge impact, this type of teaching, was that when a doctor called me a year or two ago, I forgot, and he said, listen, I listened to your audio program about crown lengthening, and I had some issues with my son. We're driving the car, and I remembered your words in the crown lengthening program about, you know, humans are this way and that way, and we all gear towards success, and it's okay not to be confident, and you can build your way up towards success. And your teaching in crown lengthening, you listen actually to this program right here, helped me talk to my son.
Wow.
So I'm like, okay, there's something there. Okay, so I don't mean to sound like, you know, I'm self-absorbed or anything like that. I'm just amazed that the effect is trickling farther than what we're teaching in the course. And we will make sure every month to make sure that you're implementing. Okay, so Delia is going to be there. Back to the slide, she's going to be there. Gumdrop is going to be presented. Okay, she's going to present. It's not a gumdrop course, but you're going to be exposed to Delia and her techniques, and of course her experience with depigmentation. Okay, so we worked as a team. Okay, so we are going global, and really the last day is putting it all together. Everything that you learned in the course, the bone grafting blueprint, the soft tissue grafting, the implant strategies and tactics, the aesthetic zone, all the magic bullets. How do we put it all together and allow you to ask questions and communicate and make sure that everything is clear throughout these 3 days? Okay, really, really important. And the last day, we're going to have fun. We're going to celebrate your graduation from the Implant Accelerator Program as part of the Surgical Master Academy here in Beverly Hills Lab on Wilshire Boulevard. I forgot the address, but
9100 or
9100 Wilshire Boulevard. It's a huge white building. We have a beautiful facility inside the Beverly Hills Dental Lab. We have Master Dental Technician Sam Alawi. It's his lab, his facility. We are honored to be there. We are happy to use this beautiful facility. But this training is not going to be just there. We're going to be different locations throughout the city. And I look forward to celebrating your graduation. You'll also be, besides being 3 days and being personally coached and mentored by you, you'll be getting also all the hands out and all the protocols and the checklists, all the consent forms, anything that you ask. And we will make sure ahead of time when we do the pre-course activity to see what you need and see what type of materials you need for your own practice. You'll be getting a bunch of CE credits just from the course alone, 30 CE credits. But every time we coach and mentor you afterwards, there'll be CE credits awarded. So you're going to get you'll get tired of CE credits because you'll have actually too many throughout this program. Okay, so pretty elaborate. Okay. Any more questions that pertain to the course? Any more Q&As? Okay, because we're getting slowly close to the end of this broadcast, and we thank Facebook, we thank Mr. Zuckerberg for hosting us here. We thank
Whose father is a dentist.
whose father is a dentist. Come on, it's a dental connection. And speaking of success, speaking of pursuing excellence, it's not a coincidence that Mark Zuckerberg, is where he's at. It's not a coincidence. He, at 10 years old, started to code, and he created a network for his dad's practice that was in their house. It was called the ZacNet. That's how he started. That was kind of the foundation for Facebook. So Zuckerberg is on a different level. That's where we should be as dentists, or strive to be the top of the game. Okay, we need to be accelerated. Okay, any more questions about the course? Any questions about bone grafting, about implants?
We have Dr. Powell from Poland, and she said, "Thanks for sleepless nights. Now is 4:30 a.m.
Wow.
in Poland."
Jak się masz? Dobrze.
And we have also Dr. Daniel Jacobi. What a team of inspirational, motivating doctors. Our regards to you, Dr. Daniel. You also inspire us, and your love for dentistry, and we realize that the path in dentistry can be difficult, and that's why we work together and help each other out. And Dr. Alfonso, very informative. And then we have, what is your take on Bicon implants?
Oh, wow. What's my take on Bicon implants? My take is that they're short. They're very short. I mean, it's so interesting that implants are, in a way, a fashion. And they're also geography specific. For example, in California, the Bicon implants are not popular.
Mm-hmm.
They're not popular here, and I don't know why. Short implants, if you're asking the general question if short implants work, they do work very well, and the research has shown that. But the specific Bicon design is very unique, and I've used it, and I think that Bicon probably has most of the science around their implants. These implants have been around for a long time, I think 20 or 30 years. And it's so interesting to see that the implant itself has a certain design where the bone grows on top of the implant. Actually, speaking of vertical augmentation, the bone grows in a vertical dimension. They have a lot of research and cases that demonstrate that. So I think Bicon is a great system. What I personally don't like about it is the prosthetics. And not that I do prosthetics, but it's a friction fit. And the way you attach component is by tapping into that. And also placing the implant is by tapping. I personally never got into that. So I never got into Bicon implants. But I think they're a wonderful solution when you're dealing with proximity to the nerve. Sinuses can be augmented. Sinuses can be augmented, no problem. But nerves should not be repositioned that easily, and usually we stay away from this option. So when you have very short distance to the nerve, a short implant like a Bicon works really well, and that's how I use that. And I'm happy to share these cases. But the system works extremely well. It's just not popular where I practice, and it's really more, I think in the Midwest, we have more of the Bicon, but they've been around forever, so a great company. Any more questions?
Set for now.
Okay. Well, we're getting pretty close to the end of this broadcast. I wanted to recap a couple of things about the Implant Accelerator program, which is really the first live course by Surgical Master, by the company that Dr. Rashad Ryman and myself are leading. We grew in numbers tremendously in the past 3 years. We are now the fastest growing online teaching platform that, from zero to however many dentists, almost 20,000 dentists, took some sort of our training, whether it's online courses, audio programs, and now live interactions, because You asked for that, and we created that. We created the Implant Accelerator program, which is a three-day live hands-on course in Beverly Hills, California, where I personally coach and mentor you. You get all the slides, handouts, consent forms, protocols, CE credits, 1-year mentorship and coaching. We can go to the slide. And this program currently is $9,885. Okay, so it comes with a hefty price. We believe that the value for this course is tremendous. It's limited to 24 dentists only. Okay, so to register for this program, you can go to implantcourse.com or simply email us, email help@surgicalmaster.com. If you want to have some more information about it. If you want to learn the best practices and strategies of what is working today, not yesterday, not the day before, not 10 years ago, what's working today in the implant world. And if you want to build knowledge and confidence, you want to shorten your learning curve, you want to move the needle, hit the ground running, okay? We're going to use all the cliches here, okay? Let's use them all because they're all applicable.
They are.
And if you want to build your own top implant practice, your own in Beverly Hills, being coached and mentored by me personally in the course and throughout this 1 year following the course, because I need to make sure that you follow through, that you implement, that you are facing those challenges and complications head on, and you eliminate all the fear. And if you want to learn all of that in one place, the Implant Accelerator program is for you. Guys, it's happening November 10th to the 12th, okay? Please don't come on the 10th. The 10th, we're starting at 6:15 or 6:30 in the morning if you want to join that early. But come a day before. If you're coming from out of town, if you're coming from a different time zone, come a couple of days earlier. Come a week early. Enjoy this beautiful weather of Beverly Hills, of Los Angeles, Santa Monica. Enjoy it. And when you come, you don't have to come alone. You can bring your spouse, you can bring an assistant, and I'm including an extra ticket in this price. You can bring another person with you, okay? Not a dentist working with you. This is for a staff member, for an assistant, an office manager, treatment coordinator, and it can be your spouse, your son, your daughter. There's a lot to learn in this course. It's not just clinical. I'm going to talk a lot about psychology, mindset, how to deal with difficult situations. Rashad mentioned something interesting. He said, hey, you treat the Hollywood, whatever, A-listers, celebrities. You see, that's not my thing, to talk about celebrities. But because practicing where we practice, we have a lot of patients, and celebrities are included, that have super high aesthetic demands. I learned how to manage those challenging patients that have extremely high demands and unrealistic expectations. And that's what I want to share. I don't want to share, okay, name of a celebrity. It's not my personality, not my thing. But I want to share with you how I dealt with that, how I lowered their expectations. Here's the trick, I'm giving it away. Lower their expectations. And you're going to do well. You can only do, okay, there's a way to do that, okay? So you're going to be getting an extra ticket for the Implant Accelerator if you join today. I mentioned my guarantee. It's a strong guarantee. Come, take the training, the full 3 days. Join us for all the training, mentoring sessions, get the knowledge, learn the skills, join the beautiful meals and activities that we're going to have together as a group, okay? Make the connection, network with other doctors like you. Okay, I told you already, the doctors in the Surgical Master Network are like you. So come be one of us, be mentored and coached, be part of the Surgical Master Academy. If you're not just satisfied, if you're not blown away, you get your money back at the end of the course. Okay, so when you join this course, your payment is non-refundable. You'll see this in the buy page. It's non-refundable because we need to make sure that when you sign up for this course, you're taking up a seat. So we can't just sign up and refund after a week. It doesn't work like that. Look at your schedule. This is why we did this on Monday night. You're working on Tuesday, tomorrow you can go into your office, or it's morning, wherever you're at. Check your schedule. If you can make it, great. If you can't make it, don't sign up and then cancel because the fee is non-refundable. But if you attend the course, you go through this training and get all this knowledge and you're not blown away, it was not what you thought it would be, you get your money back, plus you're also getting the flight back. Okay, very, very strong guarantee, and I stand fully behind it. I want this course to be the best thing ever. Now, when you join the course, there are a couple of bonuses I wanted to share with you. Some of you know them already from previous broadcasts already. You'll be getting the Implant Gold Rush online course. Okay, this is a course that was sold for almost $3,000. You'll be getting immediate access to the Facebook Surgical Mastermind. So this is I call it a safe haven. So we can be there, nobody's gonna hurt us, okay? You can post your cases. It's a secret group on Facebook where doctors can post the cases for feedback. They can learn from each other, from one another. I give my feedback. It's only for doctors that registered, okay? Bonus number 2, you'll be getting the Speak CT program, which is a general dentist guide for reading CT scans, okay? You'll be getting that as well. So I believe that every dentist needs to speak the language of CT. You can't start placing implants not understanding the anatomy, not learning CT scans. So that's part of the program. Bonus number 3 is a relatively new program that we offered a couple months ago. It's called the CGI Box. This is a program that gives you all the tools and all the videos and all the information, all the tutorials that allows you to plan computer-guided surgeries on your computer. You don't have to buy an expensive software. You actually have to have nothing except for a computer, because the program includes all the tutorials, all the instructions on how to download the software. You're getting all the data sets, the CT scans, the STL files that will allow you to plan CGI cases on your computer. Okay, and I want you to do this before the implant accelerator, because I want you to come to the course already with some knowledge. Okay, now you don't have to practice. There's not going to be any test, but I want you to come prepared. Again, we have the mindset of an athlete, of a top performer. So I want to give you all the tools to be successful. Okay, so this program alone is $2,500. Okay, bonus number 4 is the complete implant strategy training, which is an audio program, part of the Implant Gold Rush training, that is 6 hours of audio that you can listen to anywhere that you at to learn about strategy of implant surgery, how to prepare yourself, your team, your instruments, your patient, the protocols that I'm using, how to deal with complications. And it's a very comprehensive training that you can listen to. And I believe that we learn in different ways. And that's why I created teachings that include live training, that include hands-on, include audio, include online. And something's going to stick on you guys. It's going to be extremely comprehensive. Okay, so that's the audio program, the strategy training. You're also getting bonus number 5, which is the Bulletproof Surgeon, which is a roadmap that shows you the road or the path from beginner to becoming a master implant surgeon. That's something that doctors find extremely useful. It's an audio program. It's module 1 that is currently available. And I think it was written about Rashad Ryman, because that's exactly what, and you're not there yet. We're working. It's showing you the path that you need to go through. And if a doctor contacts us to join and we feel it's not a good match for the doctor, meaning they're not there according to the bulletproof roadmap, we're going to tell them, you know what, do this and that, follow these teachings, follow the bulletproof first, and join us next year, because we're going to be offering this course again, because we want to make sure that this course is going to be good for you. So if you're not clear about that, send us an email at help@surgicalmaster.com if you have any more questions about the course. If you're not sure if this is for you, or post some questions below, something that you want to know right now, we're happy to answer. So the Bulletproof Surgeon is meant to protect you. And I believe that the first way to protect you as a clinician, as a surgeon, is showing you a path that you need to follow to be successful, and not to take shortcuts and then get to the end of the road forgetting some of the basics. So it's also good for those of you that are also very advanced and already have the experience, and it's going to fill in those gaps of knowledge that you may have. Okay, so this program is $397 by itself. So you'll be getting this by joining the Implant Accelerator. Okay, so we're getting almost to the end of our broadcast. A couple more minutes. You'll be getting the Beverly Hills Implantology broadcast, $500 value. That's the broadcast we filmed in Beverly Hills a few months back. You'll also be getting the Surgical Master scrubs and t-shirts and surgical cap, now worn by surgical masters all over the world. Everybody likes to belong to the Surgical Master tribe. These are the scrubs and t-shirts I personally use. You'll be getting them as well. So we'll be touching base with you to know your size. Okay? So I feel very strongly about the Implant Accelerator program. This program is going to do all of that by guiding you through this path that led me to build my own implant practice here in Beverly Hills in California, one of the most competitive markets in the world, and really full of sharks. And I started really from nothing, really just moving into town, not even being from this country. And by utilizing the roadmap and the important stepping stones that I'm going to teach you in this course, allowed me to be successful. And I'm sharing all of that with you. Again, this program is totally guaranteed. You have nothing to lose. I removed any element of risk. If you're not blown away, your money back, and you're getting the flight back. Here's a summary of all the bonuses that you'll be getting. The Implant Accelerator course, you're getting the Implant Gold Rush, the Speak CT, CGI Box, the Implant Strategy Training, Bulletproof Surgeon. You'll be getting the 3-day implantology broadcast lessons, joining the Surgical Mastermind, and also getting our attire, the Surgical Master scrubs and t-shirts, ×2 everything. And that adds up to close to $19,000, $18,885. My investment in your education is $10,000. So I'd like to invest in your education $10,000 and reduce the cost for this course to $8,885. Okay, so I want to make sure that you're getting all these tools, all these strategies, all these resources for you to keep attending the course here, going through the 1-year mentorship coaching, getting all the CE credits, and sharing really what it takes to be a top implant surgeon. Now, when you go to the checkout page, you'll have 2 options. You can use it as you can pay in one amount. You can use a 3-payment option. We have that too. We wanted to make sure that this is a comfortable way. We totally realize this is the most expensive course in the world. We know that. We know that, and we explained before why the cost, what is the value that you're getting, why this strong guarantee, why I believe so much that this is going to change the way that you practice. So I wanted to make sure that this is going to be helpful to you, that any doctor that practices, that sees the value in being great and has the desire to be successful, has the opportunity and has the option to join. And that's why we created a payment plan. Okay, you can spread it out over 3 months. Okay, so this Implant Accelerator is happening November 12th. November
10.
12th.
November 10.
November 10 to 12. Okay, it's been a long broadcast. Okay, let's answer some more questions and then we call it a night. We'll be signing off. We've been here for 3 hours and 15 minutes. Okay, doesn't
As time flies by.
time flies when you're having fun. Okay, so thanks again for all the doctors here in attendance, watching us on Facebook, on YouTube Live, on our broadcast page. Thanks to all the technical team behind it. We did not do all of that. We strategize, we think about ways how we can create value for doctors all over the world. What's going to change the world? What can we do to disrupt the continuing education in dentistry?
And it comes from hard-learned lessons, from actual real-life struggles, from things that a lot experience but don't talk about. It's beautiful to be able to help dentists out there who are caring. There's some beautiful human beings out there, dentists, who want to do the best for their patients, for their communities, and it's a great opportunity to give them that option. We've got Dr. Tavish Gopi. Thanks a lot. I'm watching from South Africa. Thank you, Dr. Gopi, for watching and for being part of this. And we honor you and everyone out there who's actually taking the time to invest in their education, to surround themselves with people who are like-minded. Thank you, Ziv, for being who you are, for teaching general dentists and dentists in general how to become better. And that doesn't mean that specialists, we're taking things off the place of specialists. You and I do plenty of cases together that I don't feel that I would serve my patients best by doing it, and I refer it to Ziv. Actually, the more you know about surgery, the more you know how to refer, the more you actually get your specialist busy. And those of you out there who want to do surgery and enjoy it, then you should, and you can, and don't let anyone tell you otherwise. And now is the time. There's so many patients out there who need this and can benefit from this, and it's such a blessing to have Dr. Ziv Simon openly, with love, without judgment, share his knowledge so that we can grow, so that we can serve our patients, so that we can serve our families, because ultimately we become more valuable, we generate more income, we make everyone around us, we have the tools to better their lives.
No, you summed it up perfectly. You summed it up beautifully, actually. And really we've been getting so many emails with love in them, meaning doctors are telling us, thank you. Those videos every week really changed the way we practice. It really changed our mindset. It really changed the bottom line. We're doing more, we're doing better. Bring it on, bring some more. And we are also coming from a place from the heart. We love giving, we love sharing, and this is why the Surgical Master brand is known, if it's known for one thing, it's known for generosity. It's known for giving away information, knowledge, advice at no charge to the world for years, week after week, webinar after webinar, ebooks, all of the above. A lot of hard work, a lot of sleepless nights, a lot of, those circles here are not just like that, okay? Gray hair. So this is something that we want for you. We already have it. We already have it here in Beverly Hills. We practice these methods, these techniques and tactics. More dentists and more to come, because we already have a lot of doctors that joined, are utilizing these techniques, these strategies and tactics in their own practices. You can do the same. We welcome you to the Surgical Master family, to the Implant Accelerator course, a course that will really change the way you think. It will change your mindset and your idea of what it takes to be successful. We structured the course in a way that it will walk you through the roadmap of being successful with implants, with creating ideal implant sites, with the implant site blueprint, with creating, understanding strategies and tactics of the top implant surgeons, and acquiring magic bullets, those specialized surgical skills that the top surgeons are using, can be yours now. The course does not end at the third day. It takes a full year of mentorship and coaching on a monthly basis. So you are not alone. You'll get coached, mentored, you'll get the clarity. It may not happen in 3 days, but it'll spark the fire that will take you to the next level. It's almost like a rocket leaving the atmosphere. Once this rocket is launched, you cannot stop it anymore. It's impossible. Once we ignite, we don't abort this one, by the way.
No.
Once it gets ignited, this rocket leaves the atmosphere and does what it needs to do, hopefully for peaceful reasons, okay? In that sense. We want this implant accelerator to be exactly what it sounds, to accelerate your implant practice, to accelerate the way you perform procedures, and to accelerate your life, to be more successful, have more enjoyment of dentistry, more practice success, more fulfillment, more freedom, and spend some time with your family. Be more successful in your practice and do all this hard work so you can be successful. I enjoyed this broadcast with my partner and friend, Dr. Rashad Ryman.
It's an honor, pleasure.
Great to spend the time with you and answering your questions. I know we didn't get to all of them, so feel free to keep your questions going, because the post is going to be live on, actually it's going to be on Facebook as a post. You can still post questions, and we're going to answer in the next couple of days. Make sure to take advantage of this opportunity. Our spaces are limited to 24 dentists. We already have quite a few dentists that joined us from different places all over the world. I'm excited to meet all of them. And we're going to have tremendous, and this is really the beginning of an amazing journey that we're going to take together. You're not going to be alone. There's no element of risk. All the risk has been removed. This program is totally guaranteed. So if you join, you participate, and it was not what you thought it was, or it didn't create the value, you were not blown away, you get your money back, and it's guaranteed. Plus, you get the flight. Okay, the flight. And if you're not flying, if you're driving here, then I'll pay for your rental. I'll pay for your rental. I don't know. I'll pay for your hotel. It's guaranteed, guys. Let's not get to the minutia. This program has a very strong guarantee. Okay. So on that note, we're going to be signing off. Rashad, thanks again. Jonathan, Michael, we're signing off to go home, take care of our families. You need to start working if it's morning for you, or go to sleep if it's nighttime. Thanks again for your attention. We're signing off. All the best. This is Dr. Ziv Simon and Dr. Rashad Ryman here from Surgical Master. All the best.
All the best.
So I really love Surgical Master. For me, it's the strongest and the most complete online platform in the whole dental community. So I strongly recommend you to go and subscribe to the page, where you can find masters like Ziv Simon, that for me is the best teaching online. He's really the real master.
Some people are good practitioners, others are good educators. Few people have the skills of both those sets, and Dr. Ziv Simon has those. He understands treatment from beginning to end, all the complications, and is able to educate those, especially on how to deal with complications, because we all encounter those in treatment. I would highly recommend his Surgical Master series and learning from the master, so you too can be a master.
Hi, my name is Hatem Abdelhadi. I'm a dentist here in Orange County, and I've been following Dr. Cgi Simon and Surgical Master for a little bit over a year now. I was introduced to him by a colleague of mine, Rashad Ryman, and I've been following his YouTube videos and his courses, and everything he's been teaching me is giving me the confidence to perform more complex surgeries, extractions, bone grafting, membrane placement, even just simple suturing techniques has really given me the confidence and made me feel excited about performing, surgery. Thank you, Surgical Master and Dr. Simon. Thanks.
Hey, Jeffrey Rosenberg here to talk to you about Surgical Master, the unique surgical training program developed by Cgi Simon. Cgi's approach to surgery is different than any other program out there. First, Cgi is an educator. He's passionate and he's committed to having you master surgery. Just go to any of his online videos and you'll see what a special educator he is. But his new program combines online training with unique one-of-a-kind training materials that allow you to learn at your own pace and master these procedures. Surgery, it can be rigorous and it can be stressful, and Cgi's commitment is to have you develop confidence in your procedures so you can perform these every day comfortably and successfully. I know I've increased my skill set with Cgi's approach, and I hope you will too. Thanks, Cgi.
What Cgi teaches you will improve your periodontal skill, not just during the course, but beyond. Thank you, Cgi, to continuously producing your YouTube videos, which I find it helpful. Thank you to Digital Smart Design and Guided Surgery, which I fully utilize it today. Thank you.
Good morning, my friends, everybody. Good morning, Dr. Cgi. In our country, the war started on Saturday. Saturday is the first day of the week. I came to my clinic very happy to implement the work which I took with you around crown lengthening. I worked around 18 years. During these 18 years, maybe I did only 10 crown lengthening operation. After taking the course with Dr. Cgi Simon online, I started to do more surgeries. Almost every 2 weeks, I have one operation. I advise you all to take this course. It is around 4 weeks. During these 4 weeks, you can get to videos, you can answer questions. There is also one-to-one session, which helps me a lot. Today, I have a patient which I did for him a crown lengthening, and I waited around 42 days ready to take the impression. I will introduce you to him today. Thank you. Everybody, Mr. Hazim came to the clinic for the upper left molar to make a crown lengthening. Why we did a crown lengthening? We did the crown lengthening because he has a class 2 filling which fails a lot of times. Then I decided to make provisional. After provisional, I did the crown lengthening operation. Then we waited about 7 weeks. Today, he is coming to make the final impression for the porcelain fused to metal crown. Mr. Hazim will tell us his experience. How was the operation, Mr. Hazim?
Very good operation.
Did you like it?
Yes.
Thank you for your time.
Thank you. Thank you.
Bye. Hello, everybody. Hello, Dr. Cgi, Surgical Masters. Irina was at my clinic about 2 months ago. I did for her a crown lengthening operation. She will tell us about her experience. Please, Irina, tell us about your experience.
Hello, everybody. Now I feel good. It's an easy operation. I feel comfortable now and I feel new crown and I'm happy.
Thank you. Thank you.
My name is Mohammed Bish. I'm a general dentist at a Center for Family Medicine at the Egyptian Ministry of Health. So Dr. Zif granted me the Surgical Master Scholarship about 4 months ago. And I remember the first time we interacted, it was regarding a case of combined crown lengthening and lip repositioning surgery, on which Dr. Zif had published a scientific paper. After that, I was introduced to Dr. Zif's YouTube videos, which have become a daily routine of mine. And finally, I was granted the Surgical Master Scholarship, which gave me an opportunity to learn everything about crown lengthening, have one-on-one session with Dr. Zif, and attend 6 live clinically oriented sessions hosted by Dr. Zif. The whole process has affected my previous inclinations of specializing in endodontics to get shifted towards periodontics. And in addition to that, I always found that adequate professional and clinical mentorship has been proven elusive since I graduated about 3.5 years ago, until I found out about Surgical Master. So thank you, Dr. Zif, for everything. Thank you.
Hello, my name is Dr. Mohammed Sirjani. I am leaving this testimonial in support of Dr. Zif Simon's Surgical Master webinar. Personally, I think these webinars are fantastic for any general dentist who like to be more involved in the surgical aspect of their patient's treatment plan. Topics covered in these webinars are the most common topics that any dentist have to deal with in their daily office life, such as placing an implant, frenectomy, aesthetic crown lengthening, and so on and so forth. I do believe by actively participating in these webinars, any general dentist can gain a great amount of knowledge and be able to provide a much better oral health care for their patients. So I highly encourage you to watch these webinars, and I hope that you do enjoy it as much as I did. Have a great day.
Hello, my name is Richard Thien. I'm the Principal Dentist at Beyond Smiles Dentistry in Melbourne, Australia. I've been in practice for over 10 years now and have been doing surgery for almost just as long. I have participated in many different CE courses over the years with many different experts in the field, and I believe that Dr. Zif Simon is a very good instructor, and he's of very high caliber in the instruction that he gives and in his knowledge. I initially signed on to Dr. Simon's crown lengthening surgery course out of curiosity, but it turned out to be much more than what I expected it to be. Dr. Simon is very genuine in wanting to impart his knowledge and experiences, both good and bad, to help guide us in the right direction. I really enjoyed this course and interacting with Dr. Simon and also all the other surgical masters who enrolled. It's been a fantastic learning experience, and I fully recommend it to anyone out there, be it a beginner or someone who's experienced. I believe there's always something out there to learn. Thank you.
Hey everyone, just Dr. Steve Hatcher here in North Carolina, endorsing Ziv Surgical Master Program. It's an incredible program, and Ziv comes from a place of abundance, and he's elevating the standard of care. I highly recommend his course, and if you want to, do more for your patients, you got to learn more, and this is just another tool in your belt to help your patients, have more comprehensive care because they want to see you.
Hi everyone. I'm absolutely indebted to Dr. Ziv Simon for opening a whole new world of surgical periodontics to me. He is a phenomenal mentor. I just saw one of his YouTube videos. I got hooked to them and watched video after video. I wrote an email to him asking for opinion on a case. I was thrilled to see his detailed reply within 35 minutes. I suddenly felt the world is so small. I definitely recommend that to dentists around the world to not leave any opportunity to learn from this great mentor. Thank you.
Hi there, this is Vasilios Belias from Greece. I have attended the surgical master crown lengthening course. It was a great online course and a great opportunity to start in the surgical field of dentistry. Ziv is a great mentor and answered to all of my questions and I think to all of the questions of all the other surgical masters. I have accomplished already 3 functional crown lengthenings with great outcomes, and I'm looking forward for the next seminar of Ziv. Thank you.
Are you tired doing restorative dentistry, or perhaps you are tired referring out your crown lengthening patients? My name is Delia Tatal. I'm a general dentist from California, and I am here today to share my experience with Dr. Ziv Simon crown lengthening course.
Hello everyone, I'm Dr. Ying Bảo from Vietnam. I think that Surgical Master is an exclusive online training program which offers practical knowledge in aesthetic periodontal surgery. Especially it allows us to interact with Dr. Ziv Simon, our mentor, in order to comprehend all the ideas and the treatment protocol. So I believe that many dentists will get much profit from Surgical Master.
I first met Ziv at a perio course in Sydney, Australia. He was a good teacher, he was good with questions, but what I really liked about Ziv was that he was very approachable and extremely humble. That's why years on, I've decided to do an online crown lengthening course with Ziv. I found the videos to be very helpful. They're very good at explaining the concepts, and the Facebook forum that Ziv has is a good area to be sharing the good cases and also the not so good. For me, beyond just learning those concepts, having Ziv to answer my questions, having the forum, it's helped give me the confidence to implement what I've learned, which is extremely important. So if you decide to take up on a course with Ziv, hope that you're going to get as much out of it as I did.
Hey guys, I'm Dr. Chirag Patel. I practice dentistry here in Beverly Hills, California. So being fresh graduate out of school, sometimes you run into cases where you need some periodontal treatment. It might not be comprehensive, but it might be a tooth or a few, where if you're doing say veneers or if you're doing some crowns for the anterior zone, and there might be some more gingiva showing on a couple of teeth. So it's nice. After this course, it helped me at least be able to treat my patients better. I did some cases where Ziv was involved, shared pictures with him before I started. So he kind of prep talked me, kind of gave me a guideline, planned it out for me. So when it was the day of the surgery, I felt so comfortable. I felt like I was already there. this is not the first time I'm doing it. So by implementing these simple techniques, you might see that you will get your confidence up to a point where you should be able to do this routinely, where you can see these patients, be able to generate more revenue for your office, and just better for the patients as well. Going through a program, it was a comprehensive program where I'm ready. I should be able to do 6 to 11 aesthetic crown lengthening if I do get a case anytime soon. Really thanks Ziv. He taught a lot, and I'm sure that I'm still gonna be involved with him. Gonna learn a lot from him. So thank you so much for creating these videos, being able to reach out to us, practicing doctors like me, and grow from here. So appreciate all your help.
Hey guys, Cole Burney here from PracticingDentist.com, and I love Ziv's program. Since I found him online, it's been my go-to source for surgical training, and it's what I recommend for young dentists, new dentists around the country. It's a great program to invest in if you want to dig deep and get your hands dirty and start doing some surgical dentistry. So check it out. Thanks.
Hi, Carl Wirtz here, and look what I received from my friend Ziv Simon. Ziv is just passionate about teaching, and so he developed Surgical Master, and it's online tutorials. He's also doing courses now where he put together CDs of aesthetic crown lengthening. So when you're driving your car sitting in traffic, you can learn and hear from him. And I've had Ziv work with me by my chair and work on a patient together, and it's just like having Ziv talk to you while you're sitting in traffic. He also extended this one into online with videos, so that's even more helpful. So I took both courses from these and completed it, and in the mail I got this nice certificate framed, and thank you very much, Ziv. Really appreciate that. I'm going to hang it on the wall with my other diplomas.